To order the Board of County Commissioners meeting for Thursday, August 5. Will the clerk please call the roll? I'm
I heard you.
Second.
Are you recording now?
Yes.
Okay. Again, good morning. Welcome. I'm calling to order the Board of County Commissioners meeting for Thursday, August 5th. Will the clerk please call the roll?
Commissioner Fast.
Aye.
Commissioner Myers.
Myers, aye.
Commissioner O'Hara.
Here.
Commissioner Hanslick.
Hanslick here.
Commissioner Ashcraft.
Ashcraft here.
Commissioner Allenbrand.
Allenbrand, aye.
And Chairman Eilert.
Eilert, aye. All are present. We do have a quorum. Would you join with me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Liberty and justice for all. I'm going to have to ask those in the atrium to be respectful of your actions and the noise that's generated, which interferes with our electronic communications. So I would ask you to be aware of that. Glad you're here, but would ask that your conversation be very quiet and respectful to others who might be talking. Thank you very much. The clerk has an item to read.
Notice, to reduce the spread of COVID-19, physical distancing will be observed in the hearing room with limited seating. A live broadcast will still be available at boccmeetings.jocogov.org or on Facebook Live for a live feed or later when the video is posted. Public comments are being accepted for those who pre-register. Live public comments will be accepted either in person or via Zoom, audio only. Individuals wishing to speak in person or via Zoom may register by completing the registration form at boccmeetings.jocogov.org. Individuals wishing to speak in person may also sign up in person by 9:20 a.m. prior to the meeting. Online registration opens Tuesday afternoon evening, coincides with the publishing of the agenda, and closes at noon, 12 p.m. on the Wednesday before the Thursday meeting. If you complete the registration, you will receive an email notice later in the day on Wednesday regarding the status of your registration. Instructions on joining and speaking at the meeting via Zoom will be included in the email notice for individuals who register to speak via Zoom. Individuals registering to speak in person at the meeting will receive email confirmation of their registration. The BOCC has established a limit of 50 speakers for a general public comment or for a specific agenda item. If more than 50 individuals register, the 50 speakers will be determined by a random process. Speakers will be limited to 2 minutes each. If the number of speakers exceeds 50, all that are pre-registered or have signed up in person will be randomly selected to speak. If you are not chosen in the selection process, those that are virtual will be notified by email, and those that are in person will be notified by the list of randomly selected speakers that will be posted. Speakers who have registered to speak via Zoom will be called upon first to speak, followed by speakers who have registered to speak in person. Registered speakers using Zoom will be called upon to speak in the order in which they sign up. Speakers who have registered signed up in person, public comment will be called in the order specified by the deputy clerk. The chairman may modify these procedures as needed to conduct an orderly and efficient meeting. During the portion of the meeting designated for public comment, remarks should be related to county government business, but which does not later appear on the business action agenda. Comments during a public hearing or an agenda item should be related to the specific hearing or item. Comments should not be a personal abusive attack on or a threat to a person. Speakers should not expect commissioners to respond to their comments directly during the meeting. If you would like to make a written public comment for the meeting or would like to provide written comment on any business agenda items, please submit a public comment form by visiting this website, boccmeetings.jocogov.org. Written public comment forms received before noon on the Wednesday before the Thursday BOCC meeting will be shared with the entire board prior to the meeting. Written comments will not be read into the record during the meeting. If you are unable to comment using the website form, you may call the following number and we will record your information, 913-715-0424. Persons who may need assistance, the use of sign language or oral interpreter, or who require special accommodations should contact us at accessibility@jocogov.org via the Kansas Relay operator at 800-766-3777 or by phone at 913-715-0430 at least 2 business days prior to the meeting. Commissioners and presenters, please state your name every time you begin speaking so the notes can be transcribed for the record. And this is a public meeting. We are live streaming and recording it. Thank you.
Thank you very much. I will announce these modifications to that statement. The public comment period will be blended into the comment period for the public health order. There will be no separate public comment period. And the 50 limit will be removed this morning. I think we have about 25 who've signed up virtually, and we had 19 sign up this morning, and we had a number sign up otherwise. So we have about 93 or 94 speakers this morning, and none of those will be asked to not speak. There will be 2 minutes limit on each speaker. And I will have additional comments when we come to that item on the agenda. The clerk will read notes for the record this morning.
The chairman noted for the record that he would sign the following: easement conveyance with Evergy for work at the New Century Air Center wastewater treatment plant. Funding was approved as part of the wastewater facilities electrical system improvements project, CMSD Contract 27, via resolution number WD 20-016 on July 16, 2020, and administrative resolution numbers WD 21-032, WD 21-033, and WD 21-034, enlarging the privately financed sewer district and provide for the assessments of all applicable fees, charges, and levies of the Consolidated Main Sewer District in the vicinity of 169th Terrace and Oakmont Road, 172nd Terrace and Lackman Road, and 67th Street and Martindale Road, respectively. Thank you.
Thank you very much. Next, we will go to the consent agenda. Would the clerk please read the consent agenda items?
Item number 1, consider approving the July 1st, 2021 business session minutes. Item number 2, consider approving the reappointment of Christy Ziegler, 2nd District Representative to the Juvenile Corrections Advisory Board through June 30th, 2024. And item number 3, IFB number 2021-050. Consider authorizing a contract with U.S. Engineering to modify the mechanical piping system at the Criminalistic Laboratory, Crime Lab, located at 11890 South Sunset Drive, Olathe, Kansas, 66061, in an amount not to exceed $220,566.
Thank you. Is there any commissioner who would like to have any one of those items considered separately?
I just want to ask a point of clarification. So we are not doing the public comments now. We're going to wait until we're in the Public Health Board for the comments to be made. Is that correct?
Yes, that's what I said. Thank you.
Thank you, Chairman.
Is there any item a commissioner would like to have considered separately? Is there anyone present who would like one of those items to be considered separately? If not, it's back before the commission. A motion is in order. Ms. Hanslick.
Yes, thank you, Mr. Chair. I move to accept and approve the consent agenda as presented.
Allenbrand, second.
Motion is made by Hanslick, seconded by Allenbrand to approve the consent agenda as presented. Will the clerk please call the roll?
Commissioner Fast.
Aye.
Commissioner Myers.
Myers, aye.
Commissioner O'Hara.
Yes.
Commissioner Hanslick.
Hanslick, aye.
Commissioner Ashcraft.
Yes.
Commissioner Allenbrand.
Allenbrand, aye.
And Chairman Eilert.
Eilert, aye. I have 7 votes in favor. Motion carried. Moving to the action agenda, before we read that item, again, I will restate that when we come to the comment portion on this item, if there are individuals who have a general comment, you can do so at that time, and we will take both those general comments and specific comments on the public health order during that period of time. Staff will give us an overview of what the public health order contains. If there are questions by the commissioners, they can ask at that time. Following that, we will open to receive comments. For those who have signed up virtually, they will come first. And then following the public comment period, the board will have discussion and make a decision. So, Mr. Connor?
Excuse me, can I read the item into the record, please?
I'm sorry, what?
May I please read the item into the record?
Oh, yes, I'm sorry.
Item number 4, proposed health order number 001-21, elementary schools. Note, final proposed health order posted in place of an earlier version posted in air.
Okay, Mr. Connor.
Good morning, Chairman, Commissioners. Joe Connor, Assistant County Manager. The item before you today is a health order that would require all Johnson County students up to and including 6th graders to wear a mask while in the school building. Our local health officer, Dr. Joe Lemaster, along with Dr. Ariola, our Director of Health and Environment, is recommending this action. Dr. Lemaster will present his rationale on why this measure is necessary shortly. Dr. Ariola will also be on the line to answer any questions. And so the order itself is a targeted public health intervention focused on students who currently do not have access to the vaccine.
Joe, can I ask you, can you please move your mask?
Okay.
Thank you.
So what is in this health order? It requires masks or other face coverings for any students through and including 6th grade while inside a school building. The requirement includes school buildings for all students in higher grades where 6th grade or younger students attend class unless a plan for physical separation is put in place. Masks or other face coverings are required for all staff, faculty, and visitors in these buildings. Persons with a medical condition, mental health condition, or disability are exempt from this order if documentation is provided to school officials. All students, while riding the bus, will be required to wear a mask unless a medical exemption has been submitted to the school. This order would begin, effective date, if passed, would begin on Monday, August 9th, and remain in effect until May 31st, 2022, unless amended, revoked, or replaced. This is not a community-wide measure. This is targeted toward the school setting. And again, limited to those students who do not have access to the vaccines. Students participating in school activities or athletics should follow guidelines established by the schools and the State High School Association to guide their participation in those. Under this order, the outdoor activities by students do not require a mask or face covering. And with that, I'll turn it over to Dr. Lemaster for his presentation.
Dr. Lemaster.
Thank you, Joe. Thank you, Joe. Thank you, commissioners. We've got some slides up, and I'll ask for some help with advancing the slides as we move through. Can you all hear me fine?
Can you speak up a little louder, please?
All right. Can you hear me fine now?
That's better, yes.
Very good. Okay. Good morning, Commissioners. This morning I'm addressing you regarding the proposed order mandating the use of face coverings in K to 6 Johnson County schools. We're proposing this, as Mr. Connor said, as a targeted intervention to protect from COVID-19 our most vulnerable population currently, children under 12 who are not yet eligible for vaccination. Next slide, please. 2 weeks ago when I talked with you, I reviewed risk for children across the U.S., and today I'll focus on our local area. As you're aware, with the arrival of the Delta variant in our area, COVID rates have recently increased dramatically. Our current incidence rate is 229 per 100,000 population. Next slide. Our overall percent positivity in the last 14 days has returned to 8.4%. Next slide, please. Based on our previous school reopening criteria, this incident rate suggests that we're close to what we previously used to mandate remote learning at the elementary level, 250 per 100,000, though the percent positivity is still in the yellow zone. What we're proposing is a conservative approach to keep schools open and kids in schools. Next slide. Recently, pediatric hospitalizations in our area have returned to the level that they were during the winter months, as you can see on the left side, although now as a percent of total hospitalizations, children represent about twice the proportion as then. Next slide, please. This slide showing the overall regional picture makes it clear that even while we're not running out of ventilators, as shown in the lower left, the hospitals are very full and the ICUs even more so. Pediatric COVID patients represent a growing proportion of those in our ICUs. In the region, there's still some ICU capacity. Slide 7. In the JOCO hospitals, that ICU capacity is getting dangerously low. This is due to a combination of factors, including availability of staff to care for ICU patients. But overall, this just tells us that the hospitals are very busy, and for that reason, a number have started to refuse transfers in from other areas. Next slide. In summary, we're seeing a brisk rise in hospitalizations, including among children, and we also have in the county experienced outbreaks in camps where children were there, childcare establishments, especially where people were unmasked, all in the face of an inability yet to vaccinate children under the age of 12. Next slide, please. 3 facts to remember about COVID transmission among kids. We see higher numbers of cases among children when community rates are higher, as they are here now. Data from the UK suggested that for every additional 5 per 100,000 cases in communities, the risk of nearby school outbreaks increased by 72%. Children less than 12 can acquire COVID in in-person school settings and transmit it to others outside schools. We believe this to be more likely to happen during the period now that we're seeing Delta because of the higher transmission that Delta represents. At least through March 2021, when prevention strategies have been in place, transmission in schools has been uncommon. Next slide. Last time I talked to you, we talked about layered prevention. This is what CDC refers to as multiple components that have been shown to be effective in reducing transmission in schools. Consistent and correct use of face masks is a very crucial and critical element of that layered prevention strategy. Next slide. Data supporting this approach has been confirmed by studies across many states and jurisdictions and represents the minimally restrictive action you can and should take as a board given the high level of community transmission we're experiencing and given the fact that 100% of children under 12 are still unvaccinated. Next slide. To sum up overall, the risk of transmission in schools is high, as is the number of hospitalizations in our area, and ICU capacity, while not exhausted, is reduced. We continue to strongly recommend COVID vaccination for those who are eligible, but school children under 12 are not eligible. The proposed order provides us with a previously proven approach to minimize transmission in school so we can keep kids in school, and we consider this to be the minimally restrictive approach to doing so. Again, as we've said before, this is a targeted intervention to avoid having to return to hybrid or remote learning. Schools and early care and education programs are an important part of the infrastructure of our community. They provide safe, supportive learning environments for children and adolescents and employ teachers and other staff. Reports suggest that the limited in-person instruction during the pandemic may have had a negative effect on learning for children and on the mental and emotional well-being of both parents and children. Our goal in proposing this order aims to keep schools open and kids in school for in-person learning. Thank you very much for your patience and consideration.
Okay. Dr. Areola.
Good morning, Chairman. In addition to what Dr. Lumasta just said, I should first of all identify myself. I'm the director for the Johnson County Department of Health and Environment. I do want to say that we have schools in Mississippi, in Arizona, Atlanta, that have opened without mask. And within a week or two, they have all returned to requiring mask. And it is going to be very, very difficult to keep our schools open without wearing mask. The virus, the Delta variant, is the infection numbers are pretty high. Actually, the number that Dr. Lumasta provided today in terms of the incidence rate was the number that I used with you last week. This week, the incidence rate is at 331 per 100,000. That's already in red. And we are seeing a lot of cases. We are seeing lines in testing locations. We are seeing cases in younger children, and we speak to our health systems in terms of hospitalizations and capacities. And there's no question that they are very concerned about where we're heading. And we do need to take steps to ensure that we do what we all want to do, which is to keep our children in school. Thank you.
All right. Are there any questions by commissioners? Ms. O'Hara.
Thank you, Chairman. Dr. Areola, are these statistics, are these Johnson County statistics, or are these regional statistics?
The numbers that Dr. Lumasta provided to you are Johnson County numbers.
They are Johnson County numbers. I'm confused because from the dashboard, since July 1 to current, there has been one hospitalization of children under 9. And for 10 to 19, it shows that there were 2 hospitalizations, and this is a 5-week span. Is this correct? Is this information that I have from the Johnson County website, is this correct? And this was given to me by staff.
So I thought your question was referring to Dr. Lumasta's
May I,
reference.
I'm sorry, I'm going to have to intervene. For those who are in the atrium, I don't want to have the security officers clear the atrium. There are facilities in the lower level of the building which you can watch the proceedings and have the conversation you would like. But to interfere with the conversation and the activities in this chamber, please keep the volume and conversation to a minimal. Thank you.
Okay, so Dr. Areola, I'm just very.
I'm happy to answer your question,
Yes.
Dr. Areola, Director for the Department of Health and Environment. The incidence rate, as well as the positivity rate that Dr. Lumasta presented for Johnson County. So if you talk about hospitalizations, I'm happy to give you the numbers for Johnson County. We have had 15 hospitalizations in children aged 12 to 17. We have had 8 hospitalizations in children aged 5 to 11. And we have had 3 hospitalizations in the last 2 months. Those are Johnson County numbers.
Okay, so that is from June 1st to current?
The last 2 months, we have 3 hospitalizations. I don't know whether that's June 1st, but the last two months, yes.
June 1st. Well, on my statistics that I have, there has been 1 hospitalization in the last 5 weeks for the 9 and under. Is this correct or not?
There are 3 hospitalizations the last 2 months. I can't see what you have.
So, well,
but
this is from the dashboard, and this was presented to me by Joe Connors.
Yeah, Dr. Ariola, I pulled information from the cumulative summary tab on the dashboard and just did a daily, starting July 1st as a benchmark, and then looked at the numbers for the last 2 days, or 3.
Actually 3.
And so she's taken the difference between what it said July 1st and what it says today.
And
in those age categories.
Right. And
Okay.
in the last 5 weeks, I showed
Again,
you,
I do want to go through the numbers so it's clear. We have had 15 hospitalizations in children aged 12 to 17. We have had 8 hospitalizations in children 5 to 11, and 3 of those have occurred in the last 2 months. Probably they're trying to pull out the number. If you are saying from June,
Okay.
if you give me a timeline, we're able to pull that out for you.
So what you're saying, you're talking cumulative, and, okay, I'm talking specifics as to from the last 5 weeks, because we're taking this action on the assumption that this is getting to be a worse problem. And 1 hospitalization in 5 weeks, I cannot see that this is a public health issue. So
Okay.
I would love to, again, Dr. Ariola, Director of Health and Environment, the metric of hospitalization, I hope that the CMO of our health systems are going to be addressing that to the community tomorrow. I would say that when children return to school, the indoor environment is a perfect environment for the proliferation of the virus. There will be outbreaks, and those numbers from Mississippi, 2 school districts there, from Arizona, from Atlanta, those are real numbers that have happened recently. If you have kids in there, you are going to see, there will be some that you will not that may not be hospitalized. You are going to see long COVID, you are going to see MIS-C, and the more people that are infected, the higher the number of persons that are likely to be hospitalized. And so, yes, the numbers are low right now. That's the way to keep it. The infections that we are seeing, the rate at which it's going is scary. If that continues and there is no measure to contain outbreaks in school, we will, to use the word of Children's Mercy Hospital doctor, it will be a recipe for disaster.
And the piece, are these test results from the PRC that's been recalled, the PRC test that's been recalled? Is this?
I think you meant the PCR test, the polymerase chain reaction.
Yes, thank you for that correction.
It's inaccurate to say that the test has been recalled. That's what we're still using. That's inaccurate.
Okay, this is what we're still using. And is it correct that, according to the CDC, that will not be used after December? Is that correct?
That is inaccurate, not to my knowledge.
All right, I'm asking commissioners to remember we have 93 individuals who would like to make a public comment in regards. So let's recognize that and minimize our time. We will have opportunities following the public comment information to discuss items. Ms. Hanslick.
Thank you, Mr. Chairman.
Thank you, Mr. Chair. Just 2 quick questions for Dr. Ariola. Can you update us on the current vaccination rate for children 12 to 17 in Johnson County? Last I had seen from you, it was less than 40%. Is that still accurate?
It is right now at about 40.2, 40.3%. It's still right around 40%, yes.
Okay, thank you.
Mr. Ashcraft.
These are questions on the health order, Mr. Chairman, so if Mr. Connor could address them. Mr. Connor, the order appears to be directed at public and private schools. Will daycare, healthcare establishments, and other congregate youth settings be included in this order? And then by extension, What is the enforcement plan if any or all of these groups, public schools, private schools, daycares, opt out or decline to adhere to these?
Okay, so to answer your first question, if it's in the school setting in pre-K through sixth grade, it would fall underneath the order. Standalone daycare centers have their own regulation requirements through the state, and they contract with us, and we enforce those, through that action.
They aren't covered?
They will be covered.
They will be.
Well, they'll be covered under their own regulation, not by this order. This only talks about in the school setting.
Okay.
In the school buildings.
And then enforcement?
Well, enforcement we'll be working closely with the schools if cases start to rise. If things start to happen, then we will work with the schools directly. Hopefully we can end any issues that we have there.
Okay. Thank you.
Okay. All right. Let's turn to the public comment portion. The clerk will read 2 or 3 names at a time, and so those individuals need to be prepared. But first of all, we'll start with the virtual comments. Linda? And again, let me restate, for those who are on virtual or at the podium, there will be 2 minutes limit. And for those who are at the podium, there's a modem which will show the time. And so would ask that you respect that. Will the clerk please read the first individual?
The first speaker virtually is Carrie Alam. Carrie Alam.
My name is Carrie Alam. I currently have 2 kids in Blue Valley schools, Blue Valley West, Pleasant Ridge Middle. Thank you for letting me speak today. Last year was something of a unique experience in that I had 3 kids in Blue Valley at milestone year, 6th grade, freshman and senior, all looking forward to great experiences, both first and last. Of course, this is not what they got at all. My 6th grader and freshman did not have traditional first years in their new schools. They did not get their first homecoming, pep assembly, or middle school activity night. My senior didn't get her last homecoming or countless other last most seniors enjoy as they complete their high school years. While my freshman did get to play basketball, it was a risky decision at the time when COVID numbers were high. I'd let her play only because the district required masks during practice, and the freshman team decided to wear them during games also. Did my daughter love this? No. Was it difficult at times with her asthma? Yes. Did she do it because it meant she got to play the entire season without incidents? Yes, and she'd absolutely do it again. That said, everything did change when Blue Valley moved to full-time in-person school for everyone in the 4th quarter. There was a prom and a senior picnic, and these kids could attend sporting events, and they could see all of their friends every day. This is what we all want, right? Our kids in school every day, all the normal school activities, dances, assemblies, going to games on Friday nights. And I think we can agree we all want our kids safe. The experts are telling us masks are the only way. 200 doctors in our community have endorsed masking. The CDC says we need to do it. Our local children's hospital agrees. I'm not sure what else you need to hear. I don't think requiring masks for just K through 6 is enough, though. These schools don't operate in silos. Like myself, many families have kids across all levels of K through 12. We need universal masking, K through 12 students and staff. This is not an issue of personal choice. This is an issue of public health and safety. Can't even believe we're discussing this because I'm asking our elected officials to do what is best, do the right thing, universal masking for students K through 12. Thank you.
Thank you. Next speaker.
Now we have Owen Frederick.
Hello, my name is Owen Frederick. I'm from Overland Park, Kansas. To correct Mr. Areola, on July 7th, the FDA did issue a Class 1 recall on the Lyra SARS-2 COVID PCR test. The fact that you don't know that is embarrassing. This morning, I emailed the board a CDC article on the effectiveness of cloth masks for protection against SARS-CoV-2. The article referenced study on efficacy of medical masks versus cloth masks conducted in Hanoi, Vietnam, showed penetration of cloth masks by particles was almost 97%. The article went on to discuss droplet travel distance. Quote, Recommendations to wear masks to protect the wearer from droplet infections are based on the assumption that droplets travel short distances only. However, the 10 studies of horizontal droplet distance, 8 showed the droplets traveled greater than 2 meters. A recent study showed that SARS-CoV-2 may be transmitted up to 4 meters. Therefore, ideally, all frontline healthcare workers should use a respirator, end quote. Not a medical mask, not a cloth mask, a respirator. To further quote the article, quote, during a pandemic, cloth masks may be the only option available. However, they should be used as a last resort when medical masks and respirators are not available. Cloth mask use should not be mandated for healthcare workers, but some may choose to use them if there are no alternatives. The general public should be educated about mask use because cloth masks may give the user a false sense of protection because of their limited protection against acquiring infection, end quote. These studies were conducted in a hospital setting in which airspace is limited to short durations in a high filtration environment. Our public schools are a low filtration environment with prolonged shared airspace. Given the high penetration rate of cloth masks, the distance SARS-CoV-2 can be transmitted, and the low filtration environment, no credible claim of cloth mask efficacy in SARS-CoV-2 transmission prevention can be made in a public school setting. So even if the BOCC had authority under KSA 65-119, which it doesn't,
I'll have to ask you
mandate
to
compulsory
conclude your
medical device
remarks.
use,
Your time is
public
up.
health justification clearly.
Thank you. Next speaker.
Now we have Melissa Jenner. Melissa Jenner.
Thank you for the opportunity to speak today. My name is Melissa Jenner. I'm a physician and mom of 4 children, 3 of which who attend Blue Valley schools. I'm speaking as a private citizen and I do not represent a hospital or practice setting. I'm speaking in the virtual setting because I'm concerned about the potential for unmasked participants that would put myself, my younger children, and my patients at risk. I would first like to thank you for introducing and considering the proposed elementary masking mandate. Thank you for being willing to listen to our local physician and public health experts as well as to the CDC and AAP. It is a great first step. My concern as a physician is that it does not go far enough. While our children ages 12 through 17 are eligible for vaccination, our current vaccine rate for this age group is low. Most of the children up to grade 12 are unvaccinated and therefore completely unprotected from COVID-19 if optional masking in grades 7 through 12 continues. These students deserve the same protections as their younger and unvaccinated schoolmates. I want my daughter, an incoming freshman, and her classmates to have a safe and uninterrupted in-person school year. Because of the low vaccination rates, universal masking is the only option to achieve this goal. Finally, mass quarantines due to unmasked high-risk exposures in our high school students would have a great economic impact on our local community. Many of these students have jobs in the food service industry, grocery stores, gas stations, and other service industries such as home child care. Who is going to fill these positions for 14 days if we suddenly have hundreds of our students in quarantine? Businesses will have to potentially close or reduce hours. Parents that rely on high schoolers for work-related childcare in the evening and weekends may be forced to stay home with their kids. Allowing for optional masking is bad for public health, bad for business, and bad for families. I ask you to consider extending the mandate to include all grades to be in full compliance with the Johnson County Department of Health, Kansas City Department of Health, CDC, and the American Academy of Pediatrics. Thank you so much for your time today.
Thank you. Next speaker.
Now we have Allison Hettinger. Allison Hettinger.
Hello. Thank you, Commissioners, for the opportunity to speak today. I'm Dr. Allison Hettinger. I'm a Mayo Clinic trained board-certified pediatrician and a fellow of the American Academy of Pediatrics. I practice in Olathe and I have 3 kids in the Blue Valley School District. I am speaking today as a healthcare provider for kids, a small business owner, and a mom. I am seeking your assistance in keeping our kids in school. My practice has seen a significant uptick in COVID-positive patients over the last month. While most children with COVID do not appear to have long-term complications, some most definitely do. And we have a lot to learn about how this disease process affects kids over time. My practice has had a previously healthy 10-year-old develop debilitating chronic pain. We've had several high school student athletes with temporary heart inflammation and EKG changes that required cardiology evaluation and clearance to return to sports. I have pretty much daily conversations with kids about anxiety and depression, either caused by or exacerbated by this pandemic. Most of my patients cited not having regular in-person school and missing out on sports or activities as major contributing factors to their symptoms. If we are worried about the mental health of our kids, we need to keep them in school and activities. We do that by requiring masks through 12th grade. Also increasing are the numbers of viruses that we usually see midwinter. There is not a buffer of bed space or staff to absorb our typical inpatient surges of the late fall and winter. This will present yet another challenge for our healthcare system and can exceed our capacity to care for our community. As you are aware, the KDHE, the CDC, the American Academy of Pediatrics all recommend universal masking in schools K through 12 to avoid outbreaks and school closure. As districts across the South have opened up in the last weeks, we have seen several shutdowns at the middle and high school levels already. Masking is not perfect. Vaccination is not 100%, but these are the only two ways to keep our kids and our teachers healthy and in school. Yesterday, the KC Metro community added 1,115 new cases of COVID, largely fueled by the more transmissible Delta variant. This is the highest total since January 9th. We need universal masking in all of our schools, and we are asking for your help. Thank you.
Thank you. Next speaker.
Now we have Sarah Dubin. Sarah Dubin.
Good morning. Can you hear me?
Yes.
Okay. Good morning, and thank you for the opportunity to speak today. My name is Dr. Sarah Dubin, and I am a pulmonary and critical care physician here in Kansas City. I am board certified in internal medicine, pulmonary medicine, and critical care medicine. I have a master's degree in epidemiology from Yale University. I have over 20 years of medical education, training, and experience. I am also the mother of 3. I live in Johnson County, and my oldest will be in 1st grade in the Blue Valley school system. As a physician actively caring for COVID patients, I am frankly appalled that angry parents are trying to dictate the health of our children instead of those of us that are physicians and scientists. The American Academy of Pediatrics has explicitly stated that children must be masked in school, ages pre-K through 12, in order to prevent children becoming sick with COVID and schools closing. This governing body of pediatric specialists has made this recommendation to keep our children safe and in-person learning, which is what we all know is in their absolute best interest. We must stand up for the safety of our children. The argument that kids don't get sick from COVID is not applicable. The Delta variant has shown this is not the case. Kids are becoming sick and being hospitalized due to COVID. Any death that is preventable by simply wearing a mask is an atrocity. COVID is causing disabling pulmonary, cardiovascular, and neurologic sequelae in both adults and children. I know this personally from the patients I treat in my pulmonary clinic that are now permanently disabled. I am sure those on the commission want to look back and be on the right side of history and support science and the safety of our children. We pride ourselves in Johnson County as having one of the best places to live in the country. I hope you are now willing to listen to the scientists and physicians here whose sole purpose is to ensure our children are safe for now and years to come. Furthermore, I ask you to amend the order at hand to include pre-K through 12 for Johnson County schools. Our children's physical and mental well-being are at stake. Please keep them safely masked and in school. Thank you.
Thank you.
Now we have Edwin Jenner. Edwin Jenner.
Hello, Chairman and Commissioners. Thank you for giving me this time to address you and the audience today. My name is Edwin Jenner, and I live in Overland Park, and I'm the father of 3 school-age children and a teacher in Johnson County. And I hope that the Commission votes to order the universal masking of all students in our schools for, quite frankly, all the reasons that have already been stated. I don't need to waste any more of your time. Thank you very much.
Thank you.
Now we have Joanna Finkel. Joanna Finkel.
Commissioners, thank you for allowing me to speak today. My name is Dr. Joanna Finkel, and I'm a board-certified OBGYN physician here in Johnson County. I'm also the mother of 3 young children, all under age 12, and all attend Blue Valley School District. None of my children have been vaccinated against COVID-19. I want my children in-person learning, and as a doctor, I know masks will keep them there. As of now, with no mask requirement in place, mask wearing rates in schools will be low, and COVID-19, specifically the very contagious Delta variant, will tear through them, forcing school closures and ending in-person learning. Between my children's inevitable quarantines and illnesses, there are several weeks where I will not be able to provide OBGYN care for my patients. Likewise, my ER physician husband won't be available to treat your injuries, your heart attacks, your strokes, your COVID. Our family is just one example. Our local school districts have hundreds of parents who are healthcare workers, first responders, and other essential personnel. They will not be available to care for you if they are home taking care of their quarantined or sick children, and our already overburdened metro hospital system will reach a breaking point. Our community's health and our economy will be impacted, and speaking as a parent, so will my kids' academic progress and mental health. Please listen to our national and local experts who are recommending mask requirements for children, staff, teachers, and visitors in indoor settings, regardless of vaccination status, K through 12. Other municipalities in the metro have already issued mandates. We medical professionals desperately want to provide exemplary and timely care, but we need your help to do so. Thank you for your time and your consideration.
Thank you.
Now we have Rupal Gupta. Rupal Gupta.
Hi, Chairman Eilert and Commissioners. I want to thank you for considering indoor masking, which is a common sense practice that will save lives and allow our children to remain in school safely in the time of a global pandemic. I am a general pediatrician and I have 2 children who attend the Blue Valley School District. I have a 2nd grader and a 5th grader. I'm speaking today as a private citizen and not on behalf of any hospital or healthcare facility. I moved to Johnson County 5 years ago because I believe in the quality of life here, and I wanted to give my kids the highest quality education that this region has to offer. High quality education cannot be divorced from public health and trusting scientific efforts. The American Academy of Pediatrics, the CDC, even the Kansas Department of Health and Education have all stated that masking is recommended indoors in all children ages K through 12. Now, let me tell you about my experience. COVID-19 is a different virus than I have ever experienced as a pediatrician. With other viruses that are prevalent right now, like RSV, I can easily tell families about what to expect in the course of the disease, but not so with COVID, especially the Delta variant. It spreads fast, it's threatening schools where masks have not been worn in other parts of the country, and outbreaks have happened, and if we don't use common sense measures, we will outstrip our resources quickly. I've seen individuals who I know personally experience long symptoms, such as loss of taste, smell, hearing, respiratory symptoms, and other effects lasting 8 months or longer. So the children who I treat and work with and the adults who I am around are sometimes not eligible to receive COVID-19 vaccine due to their personal illness. My kids are also not yet eligible for this vaccine. Their health depends on them masking as well as all others around them. And freedom means taking responsibility to assist the most vulnerable so that they can attend school safely. It means setting up our schools safely so they can run. And it means taking common sense measures such as universal masking. I find it very encouraging that masking is under consideration for grades K through 6. I hope we can extend this to all children in school. Thank you.
Thank you.
Now we have Eva Chevrix. Eva Chevrix.
Good morning, Mr. Chairman and Johnson County Commissioners.
Have we lost connection?
1 second.
Can you hear me now?
Yes.
Good morning, Mr. Chairman and Johnson County Commissioners. My name is Eva Chevreau, and I'm here to thank you for hearing Health Order number 001-21. I am in full support of universal masking in Johnson County schools for the upcoming 2021-2022 school year. This morning, I would like to briefly share a little of my why, both personally and professionally. I'm a Johnson County resident, mother, and local nurse practitioner in pediatrics. I'm a native of Kansas, and almost a decade ago, my husband and I chose to move to Johnson County to raise our family. We selected Johnson County because of the great community and schools. We have 2 girls, 1 each in elementary and middle school level, and both too young to be vaccinated against COVID-19. Last year, our children remained virtual. My middle schooler and her classmates have never had choir or band as an option due to pandemic restrictions. So many childhood milestones associated with their final year of elementary school were withheld from them and children across the county. Our youngest has never experienced a school musical with pandemic restrictions. We were so excited for them to return to an in-person learning, and our eldest enrolled in both choir and band. I never dreamed I would need to be here advocating our county to follow public health experts to keep our most vulnerable safe. Johnson County Health Department reported that last year, with appropriate mitigation strategies, including universal masking, less than 1% of children exposed to COVID-19 became infected at school. That is a testament to our schools, public health experts, and mitigation. In our county, the 0 to 19 age demographic accounts for 20% of COVID cases, and approximately 40% of eligible students are currently fully vaccinated. With the Delta variant, COVID-19 breakthroughs and pediatric cases are all rising. The hospitals are full, clinics are full. This is not your average viral illness. We already have had a daycare and a camp as a formal cluster site in our county. If we proceed without universal masking in the schools, will be the next pediatric cluster. The impact of this on the community is not only to our health, but our economy, and it's significant. As a parent, if my child spends more than 15 cumulative minutes in a class with an unmasked COVID positive person, she will be required to quarantine at home for 10 days. For which, for us, like many working parents, means that I will have to close clinics. I have evening and afternoon clinics that previously local high school students have assisted me with childcare. Without universal masking, I will have to close additional clinics and access.
I'm sorry,
So
I'm going to
hear-
have to ask you to conclude. Your time is up. Thank you.
Now we have Shelly Ellis. Shelly Ellis.
Thank you. I'm Dr. Shelly Ellis of Johnson County. I'm the parent of elementary and middle school students who sacrificed much to spend the 2021 school year in virtual education. I have several degrees, graduate degrees, including a PhD from a top school of public health. I've spent 25 years in medical research. What that means is that I've read the studies, I understand the severity of the Delta variant, what it can do to immunocompromised citizens and employees of our county, and it means the board is optimistic that I can comment in 2 minutes. So I'll speak from the heart. Universal masking in schools is key to keeping the Delta variant at bay. Although I, my husband, and my 12-year-old were vaccinated at first opportunity, my 9-year-old cannot be. Until she can, we are conscientious that the viral load we all carry could infect her. Because she is adopted, we do not know her medical history or genetic predisposition to the disease, or how she might fare with what can be deadly, even for children. We also know that even if we are spared death, serious infection could devastate us financially or disrupt our contribution to the prosperity of Johnson County. As we would do anything to protect her, other students, teachers, and our fellow Johnson Countyans, we commend the board for bringing forth Health Order number 00121 and support its passage, amended to include up to 12th grade. Not only will masking among all schools protect our children's health, it will protect Johnson County, ensuring livelihoods and productivity will go uninterrupted, preventing lengthy and frequent absenteeism among students and employees. As a board member of a local organization, I've already made disappointing decisions to cancel community events because of the continued threat of COVID. I'm sad and angry that we are missing out on a second year of life. However, it's a small thing to ask that schools continue what they have done so successfully for a full year. Have their students and employees wear masks. It was not a problem for the children of Johnson County. Why should it be a problem for Johnson County voting adults?
Thank you.
Now we have Caroline Rawfault. Caroline Rawfault.
Good morning, and thank you for allowing me time to speak. My name is Carrie Rayfelt. I'd never planned to speak at one of these meetings, to get in the arena and risk losing friends by speaking out for what is right for my family, but unfortunately that's the position I find myself in today. The debate to mask or not has become heated and hateful. Dr. Fauci told us we wear masks not only to protect ourselves, but to protect others. Never mind his credibility isn't quite what it used to be. But that's why we're here today, right? Because choice and free will just isn't good enough when it comes to masking. One mask between us is not enough. There must be two. Health agencies and departments endorse this guidance blindly, often giving little data to support their positions. Don't dare disagree and be one of those dangerous science deniers. Science, however, is never settled. Every debate has multiple sides. Doctors fall on both sides of the argument. To say that those who've suffered due to masking don't have legitimate concerns is both dismissive and hurtful. Each side deserves equal respect and a voice. One parent's concern for their child does not carry more weight than another's. I'm curious, is all this intolerance and tension justified by that one added layer of cloth between us? Does it justify taking away a parent's choice not to cover their child's face for 7 hours a day for another school year? Are you qualified to say their concerns are invalid? No. At now 18 months in, the data does not support that forcing everyone to wear a mask will make a difference in infection rates. Our teachers, high school students, and most middle schoolers can get the vaccine if they choose. Children are still tolerating COVID well, and long COVID is rare. While Delta may be more contagious, it's thankfully proving to not be more severe. Mandates force people to do things against their will and best judgment. Orders promote bullying of those who disagree. Our county and school districts are fractured, so adding a layer of porous fabric is the magic bullet to keep the virus away, and it's worth this division to fight for it and require it. It seems silly when we put it that way, right? No one's saying anyone can't.
I'm going to have to ask you to conclude. Your time is up. Thank you. Next speaker.
Now we have Rebecca Gutzman. Rebecca Gutzman.
Hello. Thank you for your time, commissioners. My name is Rebecca Gutzman. I'm the mom of 2 young children here in Johnson County, and it is on their behalf that I'm speaking here today in support of this public health order and furthermore for universal masking for pre-K through 12. My oldest will be a first grader this year, and she is so excited to be in the classroom and learn absolutely everything she can. But she's also asthmatic, and both she and her sister have been hospitalized once already because of a virus in their short lives. And let me tell you, sitting up all night in a hospital room, listening to heart and oxygen monitors attached to your kid is not an experience I wish upon any parent. So this coming school year is causing a lot of anxiety for us as well. With no vaccine to protect either of my kids and none scheduled to be ready for months yet, the only thing they have to keep them safe are measures like this public health order. And kids really do need our protection here. They are not immune to COVID or to its potential long-term health effects. Just yesterday, the American Academy of Pediatrics reported that 72,000 kids tested positive for COVID-19 this past week, an increase of almost 85% from the week prior. In an unmasked Arkansas school district, then just the first week of school, they reportedly had to quarantine over 400 students and staff because of positive tests and exposures. Allowing this virus to spread unchecked in our schools and community only increases the possibility that in-classroom education will be interrupted and a variant might develop that does hit kids harder. I understand the desire for personal and parental choice, but viruses don't affect individual children. They affect an entire community, and right now our youngest members are vulnerable and needed this board's leadership. I'm asking the commissioners to please pass this public health order in Johnson County to keep our students safe and in the classroom in the coming months. Thank you for your time.
Thank you. Let me remind again those speakers who are speaking virtually, there is a 2-minute limit. Thank you.
Now we have Jeff Nessel. Jeff Nessel.
Can you hear me now?
Yes.
My name is Jeff Nessel, and I live in Leawood and have a son who attends Blue Valley Schools. I am old enough to remember when all the over-the-counter medication and food items did not come with a safety seal. I'm also old enough to have a smallpox vaccination mark on my arm. Remember lining up in my school's auditorium to eat a sugar cube with a pink dot to ward off polio. All these actions are examples of how society has changed to protect the individual. Because of these actions and a belief in science, people are now safer, and 2 horrible diseases have nearly been eradicated. In the same vein, helmet laws, seatbelts, and yes, even mask mandates have saved lives at no real cost to anyone's personal liberty. In a pandemic, it is not about individuals. Pandemics are collective events. To fight COVID, we need to take collective action, not fight individual battles that put society at risk. Individual battles fly in the face of what we, as members of the social contract, need to do for the greater good. I want my kid in school. He needs social interaction to grow. But I don't want to put him at risk of falling victim to a breakthrough infection that could have prevented simply by wearing of a small piece of cloth. And for those parents and some elected officials, who whined last semester to let them play and stated they were concerned about the mental health of their children, those kids had teammates and cohorts they could play and talk with. I never once heard concern for the child who was an outsider, perhaps on the autism spectrum, and truly suffered a mental health issue. And it is that same selfish and, to be honest, quite boorish behavior regarding kids wearing masks that has to do the same situation today. Because people want to make a political statement at the cost of their and my child's health. In that same vein, it is not contrary to what some publications state, a violation of HIPAA rules for someone to volunteer their vaccination status. I called people like Ms. Ellis did today to state whether or not their children of the age of 12 have been vaccinated. That would show whether they have taken an action to protect their kids and all of Johnson County. Thank you.
Thank you.
Now we have Farhara Shafi.
Hello, good morning. My name is Dr. Faria Shafi. Can you hear me?
Yes.
Okay. My name is Dr. Faria Shafi. I'm a Blue Valley mom and a practicing physician with 20 years of experience. I'm speaking as a private citizen today. Firstly, I'd like to thank all of you for introducing the health order and making public health a priority for Johnson County. This past year has been the hardest on a professional and personal level. Treating numerous patients with COVID-19 and its lingering side effects, watching a father lose his son, a wife lose her husband, and sometimes being the last person that my patients see because they cannot have their families with them. On a personal note, I have had to watch my children miss out on so many firsts and lasts, whether they were academic or extracurricular. The worst was not having grandparents on one of the biggest days of my child's life, their graduation. Grandparents who had been waiting for that moment for 18 years. They couldn't be there because COVID-19 ended their life a mere month before the ceremony. They contracted the deadly virus through one of their grandchildren who attended a school with no masking policy. Unfortunately, I know there are many more out there with similar loss because of this pandemic. I don't want any more of our youth to miss out on these formative years. They need to be at schools and not at our kitchen tables attending class. They need to be on those fields, in those concerts, and in those proms. And the only way to do that safely is through universal masking. I urge you to follow the guidance of the American Academy of Pediatrics and public health officials, and to avoid an even deadlier and more virulent Delta variant. Without that, it is not a matter of if, but when our children will be forced back into a shutdown, and kids will fall behind academically because we don't have an alternative plan. At the end of the day, we have to remember we are a community. We do not live in silos. Our students and schools are a huge part of that. If they contract COVID, think about how many more fathers, wives, and grandparents could be infected and die. Thank you.
Thank you.
Now we have Greg Williams. Greg Williams.
Hello, my name is Greg Williams. I live in Leawood, and my 10-year-old daughter, who obviously cannot be vaccinated, goes to a Blue Valley school. She's really looking forward to school, and she wants everyone to be masked. So I just want to thank the Johnson County Board of County Commissioners for their leadership in creating this public health directive. This is needed, it's necessary in order to keep everyone safe at the start of school. I also want to say that with this public health directive, and I hope that the votes are there to pass this public health directive, it creates a situation where school systems or schools that opt out of following this public health directive will be held liable should the unfortunate situation happen where a kid develops COVID. Thanks to Kansas state law, that is Kansas state law on the books, with this public health directive, schools who do not follow this public health directive will be held liable. And that's all I gotta say. Thank you.
Thank you. Next.
Now we have Sylvia Williams. Sylvia Williams.
Hi, good morning. My name is Sylvia Williams, and I'm a proud parent of a Blue Valley 10-year-old. First, I would like to thank the Commission for their proposed health directive to protect unvaccinated children in our community. As an adult who volunteers with children and who participated in a mask-mandated camp for 1,400 kiddos a couple of weeks ago, they were happy, joyful, and had a great time while wearing their mask. I also want to point out that we picked this community to raise our child because historically, this community has always protected children. We require helmets and pads for football and batting helmets for softball and baseball. I also want to reach out to those who maybe currently don't support masks for children, because I would like to share a note that I got from a close friend last October. This friend was asking for support during a difficult time, and I'll be referring to the child in this note that they wrote as a relative to protect their identity. Hi, a few weeks ago, our relative, Blue Valley student, had recovered from a mild case of COVID. This relative even had a second test saying they were negative. This relative was doing fine and back to a new normal. This relative started feeling badly all of a sudden, had chest pains and trouble breathing. This child was taken to St. Luke's emergency. After running tests, this child was sent by ambulance down to KU Med. This relative has been in ICU from this point. This child was critical so fast we could have lost them. With the help of many doctors, they have stabilized, but we have a long way to go. My friend was asking for prayers and reaching out to friends. She also shared that this was not the only case at KU Med. I will say the family had been one of those who challenged safety protocols for children and didn't believe in masks. As a parent and a caring community adult, I do not want to receive another one of these letters this year. I want to protect children, and we want to avoid these types of situations. When I look to Blue Valley, I ask how many ICU patients do we have to have before we put in these safety measures?
I'm sorry. Your time is up. Thank you. Next speaker.
Now we have Elizabeth Grismala Boos.
Good morning. My name is Elizabeth Grismala Boos. Can you hear me?
Yes.
Thank you. I'm a parent of Blue Valley students, and I also moved to Blue Valley because of the excellent education and leadership in the Blue Valley school system. I'm asking you today to also be leaders in taking steps to end this crisis using the known mitigation techniques that worked last year. I ask you to approve Health Order 001-21 and extend it further to cover those students in higher grades as well as teachers and staffs. We're in a pandemic. As a parent, I want to keep my children safe. I think all parents want to keep their children safe. We all want to keep our kids in school this year. And I'll leave the statistics to all those professionals that have already spoken that masks work, but it's hubris to wait until the numbers rise locally to make a determination that we need to be proactive, not reactive. We already have the past year to look back and see what works. The fact is that a health order, not public opinion, is what we're looking at today. So we need to trust our experts, and mandatory masking requirements are meeting in the middle. It's known effective mitigation. The pandemic has changed since the Alpha variant last year, and with Delta, more young people and children are getting sick. Public and private officials and experts are recommending the masking regardless of vaccination status, and we should trust them. And to stay in person this year, we need teachers, staff, and students to be safe and healthy. And if we're all called out because of getting sick, that's going to make it very difficult to have a more normal year. Thank you.
Thank you.
Now we have Amy Bilsky. Amy Bilsky.
Hello, good morning. Can you hear me?
Yes.
Okay, wonderful. Thank you. Thank you for allowing me to speak today. My name is Amy Bilsky, and my 9 and 11-year-old children attend an elementary school in the Blue Valley School District. I'm not a physician, I'm not an epidemiologist or a medical expert of any sort. I'm just a mom, and I want nothing more but to protect my children. And I rely on medical expert guidance on the best ways to keep my family healthy. So on top of the other previously mentioned recent news stories for schools which have already suffered from canceling classes and reverting to remote learning due to the COVID-19 spread, last night, the Kansas City Star even reported an additional 428 students and staff that are in quarantine after the first week of school in the Marion County School District in Arkansas, which did not have mandatory masking. Our children need our help. We're failing our kids by not mandating face masks in our schools. Well, I strongly believe this to be the case for all K through 12 students for this upcoming school year. I especially reinforce this for our kids under the age of 12 who do not have access to be vaccinated, and we have no options for virtual learning. We make accommodation for students with nut allergies by restricting nuts and nut butters, which are nutritional and affordable food. But we don't allow smoking in public areas or schools. Yet we can't protect our kids in a pandemic. Please do the right thing for our kids. Continue in-person learning without having to take unnecessary risks for their health. The experts all strongly recommend universal indoor masking for all teachers, staff, students, and visitors ages 2 and older for K through 12 schools, regardless of vaccination status, in addition to the preventative measures taken to prevent the spread of COVID-19 and particularly the Delta variant. Masking is a very simple precaution for our children layered into the additional preventative measures taken last school year. We need to be taking all available precautions.
I'm sorry, your time is up. Thank you. Next speaker.
Now we have Mackenzie Lee Hare.
Hello, my name is McKinsley, and I am a middle school student in Johnson County. I am in 6th grade, and I understand that the Board of Education, where I go to school, is not putting into place a mask mandate. I feel that it is not fair that they are putting me in danger and lots of other children's lives as well, and we cannot do anything about it. Do you realize that the choices you and the board members are making are affecting every child's life that does not have the vaccine? With school starting soon in Johnson County, the CDC has announced to maximize protection from the Delta variant and prevent possibly spreading it to others, wear a mask indoors in public if you are in a area of substantial or high transmission. The American Academy of Pediatrics recommends universal masking because a significant portion of the student population is not yet eligible for vaccines. Masking is proven to reduce the transmission of the virus to protect those who are not vaccinated. The Johnson County Health Department recommendations are the same as the CDC and the AAP. Lots of doctors in our area know we need to wear masks. My parents helped me start a petition. We already have over 250 signatures in 3 days. Also, I recently had a health problem. I realized how scary it is when you have a health problem and you can't do anything about it. You never know what will happen or what can come next. I want other children to be safe and not have to go through a scary experience like that. COVID-19 is very scary, and it has hurt and even killed lots of people. I really want to feel safe and protected at school. Please don't wait until it's too late. I start school next week. Please help me keep the people I love and the community safe. Thank you for your time, McKinsley.
Thank you.
Now we have Rebecca Gegg. Rebecca Gegg.
Hello, Commissioners. Can you hear me?
Yes.
Yes.
Thank you. I am Rebecca Gegg, and thank you again for placing this health order on today's agenda. I am strongly in favor of it. I'm a woman who's been unemployed since May of 2020, and I am one of millions who are no longer in the workforce. I would love to go back to work when my 8-year-old goes back to school this month in the Blue Valley District, but I can't, because we know what's going to happen in our schools without masks. Dr. Ariola said it. We're going to have outbreaks. No employer is going to hire me knowing the very real chance that I will have to stay home multiple times, probably within weeks, if not days of onboarding, because my child is quarantined. Back to school has gone horribly wrong in school districts, as you already know, in Georgia and Arkansas and other places. We saw Johnson County Parks and Recreation Camp quarantine just last month. That is here in our area. And let's say I do find remote work. There is no virtual school option. So even if I can find work and work from home, there's going to be days when my kid is home because she's quarantined. I'm going to have to take care of her, and my performance at my job is going to undoubtedly suffer. And I'm not an essential worker. Imagine what Dr. Finkel had said, that she's going to be out of work, and that's going to even overburden our health systems even more. Now, my family is not an outlier. We're one of hundreds of thousands of families in Johnson County who face these kind of questions about employment and about education and about safeguarding our community. Johnson County has long been a sought-after location for families who have generations of families who make the decision to live here because of the high quality of life. So let's do the right thing. Let's listen to the scientists, including the ones that we're paying with our own tax dollars. Mandate the masks in the schools, and please give families like mine a fighting chance. Please listen to the scientists. Don't give a false equivalency to just another parent who thinks that they know better. Please mandate the masks. Thank you.
Thank you.
Now we have Jamin Landavazo.
Hello, Chairman Eilert and Commissioners. My name is Jamin Landavazo. I have 2 children under 12, and there are 93,489 children under the age of 12 in Johnson County. Excuse me. 15.5% of our population, according to the County Vaccination Progress Dashboard. They are constituents of the Board of County Commissioners, and today I am urging you to adopt Johnson County Board of Health Order number 001-21 to require masking in elementary school students while attending school. As the order states, children under 12 cannot currently be vaccinated against COVID-19. The next best protection we have against COVID-19 is a well-fitted face mask. The side effects of masking can be discomfort and annoyance. When you look at peer-reviewed articles published in scientific journals, there have been no detrimental side effects to masking. And in January 2021 article in the Proceedings of the National Academy of Sciences of the United States of America concluded that, quote, models suggest that public mask wearing is most effective at reducing spread of the virus when compliance is high. We recommend that mask use requirements are implemented by governments, unquote. On the other hand, the evidence of side effects and long COVID are very real. In an article for the journal New Scientist in February 2021, the authors reported, quote, almost half of children who contract COVID-19 may have lasting symptoms, unquote. They went on to describe some of those symptoms, including, quote, fatigue, muscle and joint pain, headache, insomnia, respiratory problems, and heart palpitations, and up to 100 other symptoms, including gastrointestinal problems, seizures, and hallucinations, end quote. These children had, quote, at least one symptom lasting more than 120 days, with 42.6% impaired by these symptoms during daily activities. I think we all agree that children need to be in school. It is foundational for them and essential for the economy to function as it should. I'm asking you to give them the best opportunity to stay there, to learn, and to be safe by requiring face masks for elementary students. The Board of County Commissioners, according to your website, is, quote, charged with ensuring the general health of the public and broad welfare of the community, unquote. Please put your mission of public service, public value, and public leadership to work and think of the children. Do not let them and our community suffer the long-term consequences.
Thank you.
Now we have Margie Wong. Margie Wong.
Hi, good morning. My name is Margie Wong, and I am an infectious disease physician in Kansas City. I'm board certified in internal medicine and infectious diseases. I'm speaking today as a private citizen. I'm also a mother to 2 young children who will be attending the Blue Valley school system eventually. I've been directly taking care of patients with COVID-19 since the start of the pandemic, and I can't even begin to tell you how scary and sad and just horrible this past year and a half have been for me personally. I don't directly take care of pediatric patients, but as many as you can imagine, adults often become ill from their children and grandchildren. So I see the downstream effects, which I'm afraid will be a common theme upon returning to school this year. I worry about our children becoming infected, especially since we have the ability to prevent many of these infections with mask wearing. I also worry about the teachers and the staff at our schools becoming ill. I know many of them are vaccinated against SARS-CoV-2, but more and more data are surfacing with this Delta variant about breakthrough infections. On a personal note, I can tell you that I'm actually at home recovering from COVID-19 right now, and I'm fully vaccinated and have been for several months. I had a mild illness, which I think is likely from the vaccine, but I was forced to miss almost 2 weeks of work, which is very difficult on an already stretched thin, healthcare workforce. So I think there's no question about whether we will see infected students and teachers. I would also ask that the public health order of discussion includes pre-K to 12th grade. So thank you for your time.
Thank you. Next.
I have been made aware that Allie Schuler, the next number 23, is not on Zoom, and she had requested to speak virtually, so we will move on.
Okay, thank you.
We have Sean Moore. Sean Moore.
Hi, can you hear me?
Yes.
Yes, we can.
Hi, my name is Sean Moore, and I'm a resident of Johnson County, Kansas, living in Leawood, Kansas. I appreciate the time to speak today, and I really appreciate your leadership in having this measure before the board today. I would like to relate our family's unique experience to you in support of the supportive passage of this measure. Our family moved to Johnson County, Kansas in 2014, specifically for the wonderful environment that you offer here and that so many before me have, and in this call today, have mentioned. And it was expressly for this reason why our family chose to move to Johnson County, Kansas from downtown New York City. When we moved here in 2014, we were somewhat of a unique situation in that we could keep our New York City jobs, and we chose to live here specifically to rear our children in a wonderful environment. And integral to that decision was the Blue Valley school system to which our children now attend. Our kids can't be vaccinated because they're under 12 years old. We hope the vaccine will be approved swiftly, and we look forward to that sometime in January. Until then, we need you to know that we made the decision to move to Johnson County, Kansas from New York City with the underlying assumption, and so many others do as well, that boards like yourselves would ensure a safe, hygienic, and clean environment with which our children could learn. Without that assumption, I don't think we would have chosen Johnson County, Kansas. And in 2021, our family's situation is no longer unique. There are many, many, many families, just like ours, who are looking at places around the country to move because work mobility through Zoom and the internet have afforded people the ability to choose where they live and work. And those two things do no longer have to be tied together. Businesses are looking at Johnson County, Kansas right now. People are looking at Johnson County, Kansas right now. In passing this measure of having...
I am going to have to ask you to conclude. Your time is up. Thank you.
Now we have Michaela Dreyer. Michaela Dreyer.
Hi there. Thank you so much for allowing all this public comment. I just wanted to urge everyone, the Board of Commissioners, to pass Order 00121, and I want to share my experience. As a Blue Valley School District employee, I am 30 years old. I have no pre-existing conditions other than to regulate my mental health. I had taken no medications, and I had not taken a sick day from work in over 10 years as a working adult. I worked in-person learning full-time from September of 2020 on. I work closely with students who have disabilities, many of whom cannot mask. So despite the fact that I was locked down outside of work for the entire fall of 2020 and double masked with KN95, I contracted COVID-19 just before winter break. I was not hospitalized. I was very sick for over 3 weeks, and now over 7 months later, I'm still suffering from long COVID. I have a cardiologist, a pulmonologist, and a physical medicine rehab specialist. I take a steroid inhaler twice a day to clear a lung obstruction that remains, as well as 3 medications to regulate my heart, which has struggled significantly to function and oxygenate my body since I got sick. For several weeks, I was even using a wheelchair while working summer school to prevent me from fainting at work. I still attend physical therapy twice a week to help retrain my heart and lungs how to operate. The vaccine became available 2 weeks too late for me, but this outcome is largely preventable now if we can control the spread of the virus. But now I'm preparing to go back to school where if others are not masked, I will be at risk of contracting again and bringing it home to my young children who are not eligible to be vaccinated yet. As Dr. Lee Norman of the Kansas Department of Education, KSDE said last summer, schools cannot be a safe island in an unsafe community, and a mask mandate in Johnson County will allow our schools to remain safe for the students and staff in the buildings as well as for the rest of Johnson County. Thank you.
Thank you.
Now we have Michael Kerner. Michael Kerner.
Hello, this is Michael Kerner from Lenox, Kansas. Albert Einstein once defined insanity as doing the same thing over and over while expecting different results. Stop believing case and death numbers that depend on a PCR test with a high or unknown cycle threshold. That is a bogus test that returns endless false positives. Never accept any PCR result without knowing the cycle threshold used in the test, and reject any result if the cycle threshold is greater than 28. Stop accepting CDC recommendations on masking, distancing, or anything else. They are driven by politics, not science. Question every statistic you hear. Check it for logic. Check it for hidden fraud. Remember that figures don't lie, but liars figure. An example of this is the statement earlier about hospitalizations from Dr. Lemaster. He did not tell us how many of those hospitalizations were from COVID or for something else like RSV. Masking has been used on and off around the nation and the world with no discernible difference in outcomes, but this time will be different, right? The citizens of this county have been subjected to horrible and senseless rules for living and working for the last 18 months. This has resulted in massive economic dislocation. It made no sense then, and it makes even less sense now. We will not comply. Don't try to make believe that all this is legal and constitutional. It was none of that. We let our government decide that it's okay to violate basic rights for an emergency. That just guarantees there'll be a never-ending train of emergencies. In this proposed order, you are targeting children. Another lesson of recent history is that they are the least susceptible to bad outcomes. If they do contract any version of COVID, they have far fewer comorbidities. The only purpose served is obedience training. If you don't want to go down in history as evil tyrants, do not vote for this nonsensical order. Thank you.
Thank you.
I have been instructed that number 27, Martha Valencia, is not on Zoom. We will move on. Number 28, Melinda Lundgren.
Ms. Lundgren.
1 second, please.
Thank you. Can you hear me?
Yes.
Yes, thank you.
Okay. Yes. Good morning, and thank you for letting each of us speak today. The only thing I have to say is do not pass the mask mandate. It is my body, my choice. My children's body, their choice. You are teaching children that they don't have a choice for their own body, and that's not okay. Thank you for your time.
Thank you. According to my notes, that concludes the virtual comments. Is that correct?
That is correct. 1 second, please. Okay. We do have... Let me make this quick announcement. Again, I apologize to those virtually who had to be cut off. Tried to stay with the requirement of 2 minutes, and that same requirement will be for those who are speaking in person. We will continue until 12 noon and then take a short break. I doubt that we're concluded with those who want to comment, but so let's begin with the in-person. Excuse me, Chairman. We do have one that had accidentally dropped off. We have her back for virtual.
Okay.
Number 23, Allie Schuler.
All right, thank you.
Allie?
Yes, can you hear me?
Could you speak up, please?
Can you hear me?
Yes.
My issue is actually addressing the critical race material that I will be launching, and it really isn't having anything to do with this meeting. Is that something that I can speak on now, or do I need to wait till a different meeting?
Well, you can speak to that. You have a minute and 45 seconds.
I have a son who is actually in kindergarten, and I was made aware of the critical race material that I think it will be presented to the schools and the district. And he is a mixed kid. He comes home to 2 white parents the majority of the time, and also has time with his biological father, who is Black. The material that is being presented would bring division in our home, and it would affect other families. And I feel like you've got to put yourself in the student's position. You know, it's like you're bringing more segregation when you use this material than you are unity. And what you want to do is bring unity to this topic. You don't want people to see each other as a certain race. You want this to be all equal. We're all Americans. And yeah, we appreciate where everyone's backgrounds come from, but we don't want to treat them differently because of that. And by bringing more attention to, there was a video that got released at Blue Valley Southwest for a virtual assembly, and it was on. It was all on just what is the word that I'm looking for? On race and how we need to, look into other races and respect them, which I completely agree with. But it targeted white people, Republicans, and Christians. And I have a son who goes home to 2 white parents, and I would never want him to feel like his white parents are racist. And I know that other kids who are adopted, who aren't the same color as their family, and you would never want them to feel like that. I'm sorry that I don't have enough time to finish this. I will resume later.
Thank you.
Now we will have in person. 1 second, please.
The first speaker.
Now we have Haley Williams.
Ms. Williams.
Hello. Thank you so much today, Commissioners. I could stand here and give you study after study and fact after fact, but I'm afraid it would be a waste of my time. Why? Because in vote after vote, you have shown yourselves not to be concerned with what science says or what the majority of parents want, but with what the very vocal minority demands. I'm concerned you don't care about the data, that the science and all the research and evidence-based information in the world couldn't change your mind. Why? The reason we are here is because you are conducting a political theater and caving and cowering to the pressures of powers that be, refusing to listen to the stakeholders in this conversation, the parents and the children. I firmly believe masks are ineffective, but I'm not going to go around and tell any other parents they can't mask their children if they want. Yet they are telling me I must mask mine. My answer today is no. Thomas Jefferson penned these words in the Declaration of Independence. Governments are instituted among men deriving their just powers from the consent of the governed. This is America, and our system of government is a representative democracy. This is not a monarchy or a dictatorship, so stop acting like tyrants. You county commissioners, with all respect, have veered from your duty discharged to you by the founding documents of this nation and ultimately by God himself. You are usurping authority and dictating to parents how their children may breathe clean air. You are overstepping your bounds in mandating things that are not only outside your jurisdiction, but proven not to work. Do you know how I know masks don't work? I don't need a double-blind study to figure that out. If I can look at last year and say, today, if they had worked, we wouldn't be here today having this conversation. And if they didn't work, we shouldn't be here. We all have a role to play in preserving freedom. Yours today is to say no to the continuation of an ineffective, dangerous, and asinine mask mandate. This is unscientific, it's not based on research or data, it's rooted in fear, promoted under the guise of public health, and firmly built upon the idolatry and illusion of control. Ronald Reagan famously reminded us that freedom is never more than one generation away from extinction. Do the right thing, and if you don't, our fight has just begun.
Thank you. Ms. Williams, would you, Miss Williams? Again, I would remind the speakers they need to state their name and address before they begin their comments. Next speaker, Linda.
Now we have Emily Coleman.
Hello, my name is Emily Coleman, and I'm from Spring Hill, Kansas. If we mandate masks today, our children will wear masks forever. For what? For a disease that children are statistically untouched by, or for a variant that our health department can't even differentiate? Or maybe it's really for a government that wants to tax us all into poverty and dependence so that we are forced to adopt its vaccine passport and social credit score so that we can go to the grocery store. If we mandate masks today, our children will forfeit their right to intact immune systems. They will lose all right to bodily autonomy. They will be tracked and traced and scanned, and every thought they have will be evaluated for crime think. This has never been about health. Your government only wants you around so they can experiment on you while stealing your money. Don't believe me? Just ask the victims of the Tuskegee experiment. Oh wait, you can't, because they're all dead from syphilis that the government gave them. But you might still be able to find some victims kicking around from the Cutter incident, state-sanctioned sterilization, Operations Big Itch, Big Buzz, Mayday, and the countless other examples of intentional acts of violence against unsuspecting, defenseless populations by perpetrators of the state. I personally can care less what ophthalmologists, gynecologists, urologists, or PhDs who study cows have to say about masks. The only thing our government can liberate us from is our constitutional rights and our hard-earned money, but only if we let it. So since the government can't guarantee my health, even if I give up my rights, why would I willingly give up the only right that matters, which is the one where I determine what goes into or onto my body? So I'm going with the history books on this, and I'm going to take my job to protect my children from the ravages of medical fascism, cronyism, and communism very seriously. I will never teach my children to prostrate themselves to a parasitical state that pretends that it wants what's best for the population while selling us to the highest bidder. I will never allow any of you to force my children to wear a mask, ever. Certainly not without undeniable, incontrovertible evidence that this disease even exists or that these measures save lives. And even then, I will still advocate for my child's right to breathe barefaced. Thank you.
Thank you.
Now we have Cindy Hoelscher. Cindy Hoelscher.
Hey, come on. You know, let's act like adults, perhaps. And, we will have different opinions that are expressed, and we need to be respectful of those opinions. Thank you.
Good morning. I'm State Senator Cindy Hoelscher from Overland Park, Kansas. I gotta tell you, I am so damn tired of this pandemic. I've said it out loud several times and many more times in my mind. This pandemic has taken a toll on all of us, many of us in severe fashion, including my family. But here's the thing. This virus doesn't care how tired I am of it. It doesn't care how tired you are of it. Its sole purpose is to find hosts to continue the spread and to mutate. And with lower than desired vaccination rates and the Delta variant spreading, we are far from in the clear. You could say this virus is partying it up in the USA. Right now, we're at a critical point. The virus is spreading with the Midwest as the epicenter. Hospitals are filling up, and we're getting ready to send our kids back to school. We've opened up the world, and kids under 12 can't get vaccinated. Who do you think will bear the brunt of the disease now? So far, over 330 children in the U.S. have died of COVID. Do we really want to test those numbers? And the fact of the matter is, this sickness, this death can be prevented. I appreciate that many individuals have indicated they've done their own research on vaccines, masking, etc. I like to do the same. I like to stay up to date on issues, and I like to read different articles to formulate an opinion. But we all need to know our limits. I know my limits. I'm not a doctor. I haven't had training in infectious diseases. I haven't put in years of research or had my ideas tested and reviewed. So I'm going to rely on the people who have done those things and had their ideas proven. We need to listen to the experts, and the experts are saying all children need to be masked. I will leave you with one final metaphor. You're outside, it's a bright sunny day, and you see some children in the distance playing on a railroad track. You hear a whistle. You've heard the facts that kids hit by trains can die or suffer serious injury. Experts have told you that, so what are you going to do?
Senator, I'm sorry. I'm going to have to ask you to conclude your remarks. Thank you very much.
I appreciate that. And finally, the train is coming. I beg you to do the right thing. Get the kids off the track.
Now we have Joseph Julian. Joseph Julian.
Thank you for having me here today. My name is Dr. Joseph Julian. I'm coming here as a private citizen. I'm a husband, a father, and a physician that works in the Kansas City metro area. I am dual boarded in both internal medicine and pediatrics. I'm a hospitalist. I take care of hospitalized patients with COVID-19, ranging from 10 days to 10 decades old. I also have a master's in public health, so unfortunately the pandemic is almost what I'm doing exclusively these days. I'm here in full support of the Board of Health order. I do not feel it goes enough though. It should be K through 12, and I would strongly suggest a mask mandate at the community level as well. From a pediatric perspective, pediatric illness is increasing 80 to 90% on a weekly basis. Additionally, our children's hospitals everywhere across the country are going through the winter viral season right now. This meaning census is high and there's no signs of it coming back down. If we get a COVID spike in the pediatric patients, or we get the post-COVID syndrome, MISC, these things are all survivable, but if we don't have the resources to take care of these patients, that is a huge issue. From a public health perspective, there's more at stake. Kids are going to be drivers of this illness, most likely. Delta is much more transmissible. The viral loads are much higher. Kids are not vaccinated. This puts a high burden on parents and guardians and caretakers who may be out of work due to exposure or quarantine needs. So by enforcing a mask mandate, we can take the strain off of our medical system, keep our kids in the classroom where they should be, and also keep our parents working in the workforce where they should be, so we can keep moving in the correct direction. Thank you.
Thank you.
Now we have Corrine Gisler. Corrine Gisler.
Hi, my name's Corinne Geisler, and I'm a resident of Overland Park, and you have my address on file. I'm a parent of children in a Blue Valley Elementary School, children who are too young to yet be protected by the vaccine. The common sense health order you are considering today is essential to keeping them, their friends, teachers, and support staff, and our entire community safe, and keeping our schools open. Without universal masking, outbreaks will occur. We know this. We have already seen it in camps and athletics in our community. There will be continuous disruptions to our school year and quarantines, maybe even school closures. I have seen the heartbreaking emotional toll that the unexpected loss of school can take on a child, let alone the impact it has on their learning. Masks are safe. Masks work. Masks helped to keep our schools open and our wider community safer last year. Why on earth wouldn't we continue to do what we know works? What does that say about us if we are unwilling to do something so simple to protect our most vulnerable? But this mask mandate isn't just about keeping our kids safe, although I don't really understand why that's not enough. Our schools need to be consistently and reliably open for our local economy to function. Children need to be able to go to school so parents can go to work. We saw that impact last year. We saw the food lines. When parents are unable to send their children to school, it becomes more difficult for them to work. The ripples create a tsunami for some families. We have the advice of experts. We have the experience from last year. We have a simple way to keep our kids and community safer. How is this even up for debate? Please act to protect our community, your community, by passing a mask mandate for all grades. Thank you.
Thank you.
Now we have Victor Wishna. Victor Wishna.
Hello, good morning. Thank you for this opportunity. My name is Victor Wishna. I live in Leawood. I'm a parent of a 5th grader and 2nd grader in the Blue Valley School District. And what I wanted to talk about is the fact that we're a community. We're a community, and sometimes when there is a challenge affecting the entire community, we have to respond as a community to meet it. We agree on a lot, all of us. I mean, all of us want to see our kids safe and happy and in school. None of us likes to wear this mask. It's just a question of whether we're willing to accept the facts of the situation and are willing to do something simple that can make it better. And because what I do affects you and vice versa, this is a choice that we must make as a community, which is a specific authority that you all have asked to take on and that we have vested in you. I know you're carefully considering everything and striving to do the right thing, and I appreciate that. I understand you've been bombarded, you're being bombarded. But a big part of your job, your responsibility, is to know who to listen to. And you have the consensus recommendation of those who have dedicated their lives to public health, the sound advice of hundreds of doctors, the support of thousands of parents and constituents. But most of all, you have inside the knowledge of what that right thing is, the simple thing, the temporary thing, to keep our kids in school, to keep life on track back to normal. So please just shut out the noise and do the right thing. Please vote to require masks to protect our kids and one another. Thank you.
Thank you. I'm going to have to make an amendment to my earlier statement. Our closed captioner, who has to work on type kind of like a keyboard, needs a break. So we will take a 5-minute break and then come back to receive more public comment. So thank you all.
Thank you.
Okay, at this time we will reconvene from our short recess and we'll receive additional public comments. I want to remind those individuals who are speaking from the podium, there is a modem which will track the time, so you might take a glance at it every now and then. Would the clerk please read the next presenter?
Now we have Christine Vaquez.
Hello, I am a mom of 5 children in Blue Valley schools, ages 3, 3rd grade, 6th grade, 10th grade, and a senior. As our local government representatives, it is your responsibility to represent us, your constituents. First and foremost, by protecting our constitutional rights as citizens. Quoting from the White House's very own website, our great nation drafted the Constitution with a goal to create a government with enough power to act diplomatically, make war, and settle disputes on a national level, but without so much power that fundamental rights would be at risk. But health treatment mandates, in this case mask mandates, specifically for our children under age 18, the lowest risk population, is just that, power that is removing our fundamental rights. These proposed mandates are a violation of perhaps our most inalienable right and responsibility as parents, our right to choose what is good and acceptable and best for our family. Forcing parents to do anything medically to their children that violates their conscience, beliefs, and informed decision at the threat of being unable to attend school robs those children of the right to a free education and removes a parent's primary freedom. For the parents that would choose to mask their children and feel unsafe around unmasked kids, I'll steal a friend's recommendation. Let's make mask-designated elementary schools and unmask-designated elementary schools. I'll drive further for my kids' freedom, their health, and their safety. With the highest concern for my 5 children's mental, emotional, social, and physical well-being, I implore you to keep our rights and freedoms intact. I say this not in disregard for the people's health around me, but rather as an informed parent who knows that the CDC mask recommendations are ever-changing. I know there has been no COVID-19 randomized control tests on masks, although studies have attempted to indirectly estimate the efficacy. I know that testing viruses numbers are skewed and that what transmits high transmission is only 0.1% of 100,000 people. As an informed parent who values this country along with freedoms and rights that is afforded to us, I charge you, my representatives, to let no person, no committee, no emergency order, and no law have the authority to remove these constitutional freedoms.
Conclude your comments. Thank you very much. Thank you very much. Thank you very much.
Now we have Tim McCabe.
Tim McCabe, Lenexa. Christ be with me. At last week's meeting, Commissioner Jeff Myers disturbingly asked Public Health Director Dr. Arreola if there were plans to introduce vaccination centers into our middle schools out of convenience. Also, Shawnee Mission Schools voted to remask our elementary-aged students. Just over a year ago, my own kids watched their grandfather die alone on a Zoom call. The first recorded death from COVID in the state of Kansas. There are proven and effective measures for COVID, mitigations that were unfortunately denied to my father-in-law. How many masks does Dr. Arreola think that my father-in-law should have worn? 1, 2, 50? Arreola's office never even bothered to contact trace my infected father-in-law. The first casualty, now think about that. Why does this committee continue to put Arreola on some pedestal? Public emails have shown that Fauci, the CDC, and the NIH lied to us about the origins of this virus from the very beginning and the effectiveness of masks. If you vote in accordance with these public health tyrants to further hold our children and our community hostage, you dishonor the families of the fallen. This is no longer about health. This is about control. As of last week, my wife and I pulled our kids out of Shawnee Mission Public Schools. We're done with the masks, and we're done with the fear. As for me and my house, we serve God, and you should serve the public. By rejecting more mask mandates, rejecting experimental jabs on our children, and rejecting everything out of the mouth of Dr. Arreola.
Thank you.
This is a free state. I got 10 seconds left. You got a 99.9% survivability rate with this Delta variant. Take your masks off. You'll be okay, Ed. You'll be okay, Jeff. You'll be okay, Becky.
Your time is up. I'm
Figure it
sorry.
out.
Thank you. Your time is up.
Now we have Ryan Hawes. Ryan Hawes.
Good morning. My name is Ryan Hawes. I'm a resident of Johnson County, Overland Park, and I have 2 young school-aged children. I come today in peace to simply ask, please allow our parents to decide if their children should wear a mask or get vaccinated to go to school. Not the government, not anyone else in any position of authority. I'm not advocating for masks or no masks, vaccines or no vaccines. I'm simply advocating for the freedom of choice for each individual and each parent to choose for their child. I realize there's some opposition to freedom of choice under the guise of keeping others safe, and in order for you to make the right decision, you need our prayers. Therefore, John 8:32, then you will know the truth, and the truth will set you free. Acts 4:11 through 12. This Jesus is the stone that was rejected by you, the builders, which has become the cornerstone, and there is salvation in no one else, for there is no other name under heaven given among men by which we must be saved. 1 Timothy 2:1 through 2. First of all, then, I urge that supplications, prayers, intercessions, and thanksgivings be made for all people, for kings and all who are in high positions, that we may lead a peaceful and quiet life, godly and dignified in every way. Proverbs 9:25 and 26. Fear of man will prove to be a snare, but whoever trusts in the Lord will be kept safe. Many seek audience with a ruler, but it is from the Lord that one gets justice. And in ending, if you remember Martin Luther, since your most serene majesty and your lordships require of me a simple, clear, and direct answer, I give this one, and it is this. Unless I'm convinced by the testimony of the scriptures and by clear reason, for I do not trust in the county commissioners or the health department alone, since it is well known they have often erred and contradicted themselves, I am bound by the scriptures I have quoted today. My conscience is captive to the word of God. I cannot and will not retract anything, since it is neither safe nor right to go against conscience. So here I stand. I cannot do otherwise. God help me. Amen.
Thank you.
Now we have Michelle Henry. Michelle Henry. Yes, I did.
Miss Henry?
Michelle Henry.
Michelle Henry, and you have my address.
Could you pull the microphone down a little
Sorry,
closer?
thank you. Michelle Henry, you have my address. I'm here to request you please consider all children when you make your decision today, including those with cognitive and developmental delays like my daughter, and vote against enforcing a mask mandate for children. According to the NIH, nearly 1 in every 12 children in the U.S. has a speech disorder, and the use of visual prompting to show how speech sounds are made is essential in their progress. Enter masks. According to an article published in the Journal of the Acoustic Society of America, face masks muffle high-frequency speech sounds and block visual cues. All masks tested attenuated, reduced high-frequency sounds above 1 kilohertz. These high-frequency signals are important for hearing sounds like s, f, and th, which are usually the most challenging sounds. Oftentimes when I share with people that my daughter has apraxia and needs to see my face to learn to speak, needs to see your face to learn to speak, they respond by asking, why don't I just use a clear mask? According to the study's findings, their experiments show that clear masks strongly degrade high-frequency sounds as well. Side note, they also fog, so the visual piece is distorted again. This study states that masks may be especially frustrating for teachers who will be expected to wear them while teaching in person this fall. Children like my daughter also struggle with social emotional skills. In a study by the University of Wisconsin-Madison, researchers showed more than 80 children ages 7 to 13 photos of faces displaying sadness, anger, or fear. And just to clarify, these are typically developing children who are past the age of learning and who have already developed these skills. So this doesn't even take into account children like my daughter. But here's what the study found. The kids were correct about the uncovered faces as often as 66% of the time of guessing one correct emotion from 6 emotions. With a mask in the way, they correctly identified sadness only 28% of the time, anger 27% of the time, and fear 18% of the time. This study ended on a positive note, stating, even if the entire crop of 1 to 6-year-olds globally experiences some form of delay, they'll be in the same boat as their classmates. It'll be a shared global problem, and we all know about it. Isn't that wonderful? I'm asking you to take into account this data and please do what is best for all children by not requiring masks that have been proven to stifle speech and social emotional development, especially for kids with special needs.
Thank you. Next speaker, thank you.
Now we have Shad Thompson. Shad Thompson. Do we have Shad Thompson? He is coming.
Shad Thompson available?
He's coming.
Here, okay, thank you.
Hi, Shad Thompson. Apologies for being late. I'm a father of three. I've got a son in Ravenwood, daughter at West, and sorry guys, a daughter at Summit. So I've got a kind of a stake in this. I've said this last time I spoke. You know, freedom always needs to win, guys. This is personal freedom of choice is the way to go. You guys actually have an easy way out. You're damned if you do, damned if you don't, right? And this one, follow the numbers. Just look at the math. Look at the numbers. Only the numbers. COVID is here to stay. We can't mask ourselves forever. It's not going to work. So healthy kids are like I don't know how many zeros, 0.000 chance of getting sick from this, guys, unless they have another adverse condition. Other than the states, other states in the U.S. and other countries have tried what people are proposing. Look at their numbers. Like I said, back to the numbers, not the politics. I emailed this study to you guys this last week. 10 million people in a Chinese study, asymptomatic spread, 300 people out of 10 million. That means it doesn't happen enough to be worried about it. If you're sick, stay home until you're fever-free for 48 hours. Let's go back to how we treated the flu, which still kills more people. Or is it the COVID? Because we can't tell because the PCR test is now invalid for telling the difference between the two per the FDA. So please understand all of our confusions, why we're here en masse to talk to you, because we're very confused because nothing makes any sense anymore. I actually talked to 3 doctors this past week. It's like, can you please send me one study, just one, showing that masks help prevent anything? And they said, we can't. And I'm like, why? It doesn't exist. If you've got it, reply to my email and let me read it. I'd love to read it. If we're truly about health, why aren't we boosting people's immune systems? Instead of having a mask on when you come to the school, why don't you hand them a vitamin D packet, vitamin C, and some zinc? That would do a lot more for them than the mask. 75% of people now with all these outbreaks are fully vaccinated. So you guys need to pick a narrative and stick to it. Bye.
Thank you.
Now we have Catherine Holahan. Catherine Holahan.
My name is Catherine Holahan, and I'm the mother to a 14-year-old girl and 9-year-old twin boys. I have a very important reason for being here today, and it's for this guy right here, my son Connor. He's entering 3rd grade at Mission Trail. He has the ability to instantly befriend just about anyone. He has a wicked soccer kick and has the best belly laugh I've ever heard. And he knows just about every Star Wars character ever created. He also knows what a nephrologist is and the extra steps he must undertake to keep his one kidney safe and functioning. He knows a simple head cold will leave him in his parents' shower in the wee hours of the morning, hoping the steam opens his lungs and prevents another round of breathing treatments and steroids. And he understands he's one of the reasons our family opted for Blue Valley's virtual school program last year. The last school year was a tremendous undertaking, and it came at large personal cost for our family. But we did it because we wanted to keep everyone safe. Virtual school via the district is no longer an option, and in truth, Connor needs to be in the classroom. He needs his friends, his Mission Trail family, and until he can be vaccinated, he will wear a mask. But all the science tells us that even if Connor does all the right things, true protection only comes when everyone around him masks too. My son deserves a safe education. All our children do. And every major medical association has stated that mandatory masking is the only way to accomplish this goal. My kids understand they mask not only for their own protection, but also out of respect for others. Masking can save lives. It's a small price to pay so children, including those with pre-existing medical conditions like my son Connor, can safely continue their education. Please don't take away their best chance at a safe school environment. The kids have been through so much these last 18 months. As a mother, I'm begging you.
Okay,
Please
I'm
don't
sorry,
mandate
I'm going to have
masks
to
within
ask you to
schools.
conclude. Thank you. Next speaker.
Now we have Abby Ritchie. Abby Ritchell. Sorry, Abby Ritchell.
Hi, everyone. I'm Abby Richley from Lenexa, Kansas. Thanks for having me here today on this 511th day to flatten the curve. I'm not a doctor or a scientist, but I'm coming to you here as a mom. It's my duty as a mom to question and research everything for my kids. The school board, the government, and Board of County Commissioners are not the experts on my kids. That's me. Mandates are not laws. The CDC, the school board, and you have no authority to make laws. We are entitled to our own bodily autonomy and personal responsibility for our health and ourselves. It's shameful for you to want to mask children. We see you in pictures online and out in the community without masks. How dare you try to mandate this for our kids? And to the people that say, it's just a mask, I say, okay, it's just 2 weeks. It's just till things get better. It's just for the school year. It's just a vaccine. It's just your job. Now it's just you. We cannot comply our way out of this one. The time for compliance is over. The pro-maskers say that we're selfish. Well, we've been doing this for more than a year and we haven't gotten anywhere. Masks on school children do not come without risks. I have 2 kids in school and they both have medical mask exemptions. Coming home daily with headaches, nausea, vomiting, anxiety. I took them to the doctor and he was horrified by what my kids have experienced all school year long. If it passes this time, folks, this is never going to end. Understand there's always going to be a new variant because that's what viruses do. Every school year, it's going to be just until it passes, just until flu season's over, just until spring break. No more mandates. Last year it was school, this time it's masks. Next year, I guarantee it'll be the vaccine. No more, we will not comply. Thank you.
Thank you.
Now we have Daniel Austin. Daniel Austin.
Hi, my name is Daniel Austin. I live in Merriam, Kansas, and I wanted to pick up where I left off regarding Dr. Pamela Popper's "Here's What the Government and Schools Have Done to Children" in the Forbidden COVID-19 Chronicles. What are the consequences of high carbon dioxide levels? According to the Minnesota Department of Labor and Industry, at high levels, the carbon dioxide itself can cause headaches, dizziness, nausea, and other symptoms. This could occur when exposed to levels above 5,000 ppm for many hours. Remember that the school day is 6 to 8 hours long, depending on the age of the child. This means that children were exposed to as much as 5 times the amount deemed potentially hazardous for several hours daily for several months. This explains some of the issues reported in a German study in which parents, doctors, teachers, and others were asked to enter their observations and experiences with masks into a registry. According to data reported by the parents for over 25,000 children, average time per day for mask wearing was 270 minutes per day, and negative effects reported were irritability, 60%, headache, 53%, difficulty concentrating, 50%, less happiness, 49%, reluctance to go to school, 44%, malaise, 42%, impaired learning, 38%, drowsiness or fatigue, 37%. What is most distressing about this is that public health officials had to know that not only were the masks harmful, but also completely useless for preventing the spread of any virus, including SARS-CoV-2, which measures 0.125 micrometer in size and can penetrate any surgical mask. And I see I'm running out of time here. I will pick up next Thursday.
Thank you.
Now we have Laura Klingensmith. Laura Klingensmith.
Laura Klinging-Smith, Stillwell, Kansas. In my opinion, this public health order for masking children 6th grade and younger is nothing short of county-sanctioned child abuse. Since this order ends on May 31st, 2022, this is no longer about stopping COVID or safety. It is merely a power play by the county. I say this because the order states a child can wear a t-shirt or towel simply wrapped around their lower face. Not a mask, but a towel. So the county admits masks do not work, because if a child can simply pull a dirty t-shirt around their face, then what does a mask do? The Kansas governor cannot issue a mandate for 9 months, so how does the county have greater authority than the governor? This order is nothing short of age discrimination, because you are targeting an age group not in danger, but only because they cannot get the vaccine. In the age group Areola wants to vaccinate, only 14 were hospitalized in the last 19 months. In these last 19 months, how many children were treated for suicide attempts? Let's see those numbers, because I am sure that number is far greater, but yet you blindly follow what Areola says without questioning this hired employee who's not even a doctor. By signing this order, the county will have masked kids for 2 school years, making this permanent, not a temporary measure. The 14th Amendment and the Kansas Supreme Court have guaranteed personal autonomy and stated parents have full authority in the upbringing of their children. Not Areola, not the county commissioners, not the school boards, just parents. So how can you violate a ruling by the Kansas Supreme Court by signing this order? And furthermore, how does the county have authority over private schools as this order applies to them? Because in the end, my child, my choice. Thank you.
Thank you.
Now I have John Allman. John Allman.
Good morning. My name is John Allman. I'm from Olathe, Kansas. I'm here today to speak against any mask mandate for the county or for students. When 26 of 28 predictive models from the CDC can't even predict 2 weeks in advance, it's clear that they don't know what they're doing. Cherry-picking data should never be used to force mandates on masks on anyone, yet you all seem to be prepared to do just that. We've had enough. We've had enough of public health officials changing their story, lying to the public. We've had enough of members of this board saying to wear masks and then not doing it in public. We've had enough of constant changes coming out of organizations who say you either speak for science or that if you criticize them, you're against science. How many times does Dr. Fauci have to lie to this country before people stop believing him? The CDC says wear masks, then not to wear masks. Now that bastion of conservative thought, CNN announced on Tuesday that 99.999% of fully vaccinated people have not had a breakthrough case. So what's the number? At what point do we say to the people pulling our strings enough? Well, I'm telling you enough. This new fiasco about the Delta variant was kicked off by cherry-picked data. CDC was actually pretty open about it. Very small, very statistically irrelevant sample. If vaccinations work and prevent death and the severity of this disease, and they're pretty much available to anyone who wants them, obviously, except for kids, then you guys have no justification forcing masks on anyone. And by the way, if masks work, why are we here 18 months later with this problem? Thank you.
Thank you.
Now we have Jacob Swisher. Jacob Swisher.
Good morning, Chairman Eilert, commissioners, and fellow citizens. Jacob Swisher, and I'm at 601 North Merlin, Suite 7 in Olathe. I've spoken to this board previously on various issues. Today I'm here to speak with everyone else about this mask with our children. I respect the fact that you're charged with the public health of Johnson County, and I thank you for filling that role the last year and a half. We need to pause and address some fundamental roles that this body has grossly overreached. We have 6 school districts and thus 6 school boards that are charged with the direction, respectively, of their districts of our children. It's time to allow our school boards to make the decisions that best represents their district. Based on your own website, for individuals under 19, we have had 14 COVID cases since March of 2020, 3 hospitalized, 0 in the ICU. Hear this, 0 in the ICU. As long as I've followed county government, we have had an ongoing debate with Topeka about the continuous handing down of mandates from Topeka to Johnson County and how it affects our manpower and us financially. Inserting yourself in today's decision only screams of hypocrisy with that issue. You're here to represent the people and not dictate from on high. We have just had an election on Tuesday evening where many people spoke clearly of their opposition of individuals in leadership that are not listening. We have an election next year, and this issue will follow that. Thank you for your time.
Thank you.
Now we have Kevin Combs. Kevin Combs.
Are we ready? Hi, my name is Kevin Combs. I'm in West Olathe, and I am a mechanical engineer who actually studied HEPA filtration. The mechanics on how masks work are common sense. When you breathe in, a proper mask will seal up tight against your face and filter out the germs. When you exhale, the germs simply blow out the sides, as you can clearly see from this experiment. Only a rigid strap can prevent that from happening. Filtration media is designed to be one-directional, not for personal protection, not two-directional for others. That's why filters have arrows on the side. Here in about 20 minutes, you're going to hear our health department explaining their biased, one-sided trash on their advantages to forcing masks on poor children, which I think is just to cover their own butts from liability. But will they also discuss the disadvantages of forcing children to wear masks all day? There's a statistically 0% chance that my kid will die from COVID or even be hospitalized, but there's a 100% chance that my daughter with difficulties in speech will not progress for a second year in a row if she is forced to wear a mask. Claustrophobia and other psychological issues should be addressed by a professional before you all make any motions here today. My question for you is, will there be a child psychologist here speaking? Only then can you make an informed, thoughtful, two-sided decision. The proper action here is no action. As of today, we're doing fine. Our community is healing, and parents that are concerned for their kids' safety can send them to school with an N95 mask and eye protection for almost 100% protection. Will they do it? No. It's because they look silly. And the rest of us can concentrate on our own family's concerns, which for us is speech and social development. Definitely not COVID. So we'd appreciate you staying out of our family's business and not making any motions here today that violate our family's freedom of choice.
Thank you. Thank you
Now I
very
need
much.
Andrew
Your comments are concluded.
Blackburn.
I'm
Andrew
sorry. Thank you very much.
Blackburn.
Your comments are concluded.
Not effective.
Hello, Board of
Andrew
Commissioners.
Blackburn.
My name is Andrew Blackburn. I'm from Olathe, and I have two boys, ages 6 and 4, who have been wearing masks everywhere they go for the last year and have not complained once. I don't think I need to remind you that you are not just the Board of County Commissioners, you are also the Board of Public Health, charged with ensuring the general health of the public. I will remind you, though, that your responsibility extends to the entire community, even those who are too young to vote for or against you in your next election. School boards are not looking to you for political cover. They are looking to you for guidance, because the moment you are sworn in as a county commissioner, you are also sworn in as a public health official. It is your responsibility by virtue of the office you hold, and you do not get to shrug it off just because you yourself are feeling political pressure. The possibility of school districts opting out has no significance to this conversation. This is still your responsibility. If a school board believes that a mask mandate is the right choice but feels pressure from angry anti-mask parents, they need your support. And if a school board is determined to keep masks optional, use this moment to send them a message. Show them that to do so, they'll have to not only defy the CDC and the American Academy of Pediatrics, but also their own Board of Public Health. If we truly cared about each other as a community, we wouldn't need mask mandates. We'd wear our masks and send our kids to school in theirs. But we have proven that we are collectively too selfish, too concerned with our own comfort and our own individual rights to make that caring choice on our own. And that's why we need a mask mandate in our schools. Please, as you cast your vote today, think about the kids and families who could be hurt if the Delta variant begins spreading through our schools a week from today. Think about the teachers and staff in our schools who have been taken for granted in every turn in this conversation. Think about families of color who have been disproportionately impacted by COVID, both nationally and here in our county. Think about the immunocompromised relatives kids could bring the virus home to if they pick it up at school. But then think about all the good that a mask mandate could do for so many in our schools and in our community. Please vote yes and give our kids the safe in-person school year they deserve. Thank you.
Thank you.
Now we have Emily Carpenter. Emily Carpenter.
Good morning. My name is Emily Carpenter. I reside in Lenexa, Kansas. I'm a mom of 4 children, 14, 12, 9, and 3. First, I'd like to clarify, there is no state law that holds schools liable, like Greg Williams stated. I absolutely love that we start each Board of Commissioners meeting with a Pledge of Allegiance. I love that we all stand together with our right hand over our hearts, and we state out loud in unity, one nation, under God, indivisible, with liberty and justice for all. I love that we live in an America where there is a place that laws are in place to protect our liberties and freedoms. You as a board cannot pass an order, mandate, or give recommendations that violate state law or infringe on any right protected by state law or the Kansas Constitution. I have emailed each one of you the state laws that would be in violation if you pass this health order. I absolutely believe that the health and safety of all students and teachers in Johnson County must be a priority while on school property. But again, any policy put forth before the Health Department or the Board of Commissioners must not violate state law. We must work together as a community. Our children are watching us. Let's show them how to work together as a community and protect them by upholding the freedom that so many Americans fought for and the freedom many Americans lost their lives for. Masks are medical devices. Allow each individual medical decision to be made between the student, the parent, and their own personal medical physician. By keeping masks optional, you are giving the parent the freedom to choose what is best to protect their own children. If a parent wants to send their child to school with a mask, they should have the freedom to do that. Send them with 3, 4. But if a parent chooses not to send their child a mask, they have the same level of respect, must be reciprocated. The biggest compliment you can give every parent in Johnson County is to say, these are your children. We trust you as their parents. Keeping masks optional gives everyone the freedom. Not your children, not your decision. We will not comply. Thank you very much.
Thank you.
Now we have Edward King. Edward King.
Hello, my name is Edward King. I live in Overland Park, Kansas. I'm a nurse practitioner working here in the Johnson County area. I work in an emergency department in Olathe. During my time working in this acute care setting, I have witnessed several patients who have contracted and become severely ill with COVID-19, both pediatric and adult patients. Granted, many of the vaccinated patients that we have seen have significantly less severe illness and not requiring hospitalization, but we are seeing more and more unvaccinated patients coming into our ERs, and the hospitals are getting more and more at capacity. We have actually had several transfers denied from our hospital due to other areas, not just in Johnson County, but in the entire KC Metro, that cannot accept patients. Unfortunately, children 12 and under cannot be vaccinated, so they fall into this unvaccinated category, and they are at higher risk of contracting this disease. They are also at higher risk of spreading this disease to other children and adults. Guidance from not only the Centers of Disease Control and Prevention, but also from the American Academy of Pediatrics is recommending the wearing of masks for unvaccinated children that are attending school in person. COVID-19 is still very prevalent in communities across the nation, including Johnson County. As Dr. Lemaster said in his presentation, he has shown the uptick, and we are heading on a higher incidence of infections potentially if we do not take action. This recommendation does not come from anecdotal sources or personal opinion. This is a recommendation of experts in infectious disease and pediatric medicine. This is not an unreasonable request to make in order to safely keep schools open by requiring K through 6 to mask. I would suggest it should go further and go K through 12 as well as adults in the community. This is not political. This is not an infringement on people's rights. This is a basic safety measure. We can argue the statistics and data as to whether or not masks are effective, but they are a simple measure to implement. It is a choice that affects everyone in the community, not just personal choice, when an unmasked person causes another person to become ill. My hope is that the Board of County Commissioners will choose to adopt this measure and go forward with it. Thank you very much.
Thank you.
Now we have Debbie Detmer. Debbie Detmer.
Hello, I'm Debbie Detmer, grandmother of 8 and a retired RN nurse. First, let's look at these massive numbers of infection of the COVID virus, as reported via the PCR test, that is now known to have produced massive false positives. These PCR tests are now being recalled. It was developed without an isolated COVID sample, according to the FDA. It was calibrated most likely with a cold virus. The CDC's director, Dr. Walensky, had promised that the vaccinated people could not spread this virus and infect others. Recently, she publicly stated that vaccines are failing and that the vaccinated people may now carry the same or even higher viral load than the unvaccinated people. The entire promise of get vaccinated to get back to normal just unraveled, with the CDC's demand that the entire nation revert to mask mandates, even the fully vaccinated. I am requesting from you and Areola and LeMasters, the Johnson County Health Department, an isolated SARS-CoV-2 virus. I want to see it. Not one from a lab or a PCR test. This would give you and them the scientific proof of this pandemic through real science that would then allow for you to make any of these choices that you're attempting to make. The CDC and the entire medical establishment has suppressed the only legitimate solution to this pandemic, which is natural immunity, which can only function efficiently combined with good nutrition and supplements of vitamin C, D3, and zinc. The children under 20 years of age, there has been 0 deaths since the beginning of this pandemic. And how many of your children have already had the virus and have this immunity? Do you know? It could be up to 40%. My child, my choice. The signs of this infection, this new viral infection, is not shortness of air. It is just runny noses and sinus infection symptoms. Check out what the symptoms are that go out there running right now.
Thank you.
Now we have Heather King. Heather King.
Good morning. Heather King, resident of Overland Park, parent, nurse anesthetist, and I'm here as a private citizen. My 9-year-old also wanted to be here and wants masking. Her whole class wore them last year, and they did absolutely wonderfully. I watched them play outside and be happy and learn appropriately. We are now facing a public health crisis in Johnson County. Please listen to the hundreds of local MDs and hundreds more on the national level when they warn you of the dangers of this change in COVID. Anyone can get it now, so everyone should be protected by masks at school and the county level. I ask you, why would all the doctors and scientists lie or exaggerate? What would they possibly gain? This is a safety and health issue only. Healthcare workers, even before COVID, have worn masks every day for years, as have I. As a healthcare professional, I do not struggle. I do not have any health side effects, and we do it for all of you, not for ourselves. When an MD or an advanced practice provider recommends a treatment to a patient, they're not considering who the patient voted for or will in the future. They recommend based on science and what is best for the patient. Yes, Delta is a change. And yes, putting masks back on is a change. Science always changes. As more research is done, we learn more of what we know right now, and what we know now is that we need masks to keep everyone safe. I was one of the first vaccinated, but work in a risky field, so continue to wear masks for me and for all of you. I will continue to do so for all of you and for all of the children. Wearing masks is not taking away my freedom. It is ethical and the responsible thing to do to ensure the health and safety of myself and others. We're required to drug test, get TB tests for jobs. We can't smoke or take peanut butter into schools for the health and safety of all. So I'm asking you to call for a vote and amend for full
Thank you.
masking. Thank you.
Now we have Stacy Kelly. Stacy Kelly.
Hi, Stacy Kelly, and I live in Gardner. I'm a mother to 4 kids in a Johnson County school district without a current mask mandate. All of my children are under age 12, and they're unable to be vaccinated at this time. One of my kids is also immunocompromised. In addition to being a mom, I'm also an emergency medicine nurse practitioner, working anywhere from 48 to 72 hours a week in our local emergency rooms. In the last 18 months, I've traveled to hospitals in New York and Texas when those communities and hospitals were fatally inundated with COVID. Now here we are in Kansas, suffering much the same, and there's nobody to come help. I've been elbow deep in COVID for the last year and a half, and I find it absolutely appalling the level of blatant disregard for science we are seeing. No amount of research trumps firsthand experience. Everyone knows about the recommendations set forth by every major medical organization to mandate masks in our schools, which some of our districts have chosen to follow, and some districts in our county have voted to not follow this recommendation. Masking keeps our kids healthy, our teachers healthy, and just as important, it keeps them all in school. We know this because we were able to keep our schools open last year by following this recommendation. And although we have big disagreements about masks and what constitutes personal choice, I think we all want our kids in school. They need to be in school, and they need to be safe while being there. I implore you to please follow the recommendations for a mask mandate in our schools. Just like we don't ask our landscapers for advice regarding our retirement investments, please listen to the experts and pass this public health order. Because at the end of the day, everybody loses when saying I told you so. Thank you for your time.
Thank you.
Now we have Mandy Crook. Mandy Crook. Mandy Crook.
Is Mandy available? All right, we'll wait just a second.
Mandy Crook.
Okay, let's go to the next person, and if she arrives, why?
For the record, I'd state number 26, Michael Round, had canceled this morning. So we'll go on to number 27, Tammy Bennett. Tammy Bennett. Tammy Bennett.
Hello, my name is Tammy Bennett, and you guys have my address. I'm here to discuss public safety. I keep hearing a lot of talk about public safety, but I want to point out that this really makes no sense when we have a border that's wide open with over 1 million people that have come across and tens of thousands that they've actually dispersed around our country that are undocumented, and we have no idea of their health status. So you expect us to believe that we're supposed to be concerned about our public health and this pandemic when they're actually spreading it across the country, and we're supposed to wear masks and get vaccines and do all these things. It makes zero sense. And until somebody can explain that, I don't know why we should do anything that you're all telling us to do as far as public health. Second, I want to talk about testing and the release from the CDC about how the PCR tests can't even accurately distinguish between COVID and influenza viruses. So I would like to know what data we're using to explain all these cases that we supposedly have of COVID, and now the Delta variant, which still can't really be tested. So where are these numbers coming from? Why should we all be afraid and running around in masks and masking our children? There will always be another variant, another outbreak, another something. Let's get the kids back to school like normal and let us live our lives without the constant nanny state and fear. Just like the scary Children's Mercy story that said the hospital was full of COVID patients, but Children's Mercy released a statement saying it was actually RSV patients. At the end of the day, it's the parents that are in charge of their children, not the government. Let the parents decide what is best for their children. My child, my choice.
Thank you.
Holly Stark. Holly Stark.
Hello, members of the board. My name is Holly Stark. I'm a resident of Overland Park, Kansas.
If you vote to approve the proposed health order today, you will put all of Johnson County schools at risk for losing state funding. Our kids deserve to be treated equally regardless of their vaccination status, and our state lawmakers agree. In May, they passed SB 159, which prohibits the Kansas Department of Education from providing funds to schools that use vaccine status to deny education, deny entry into their premises, or separate individuals by vaccine status. The proposed health order violates the spirit, purpose, and content of this law. All children 6th grade and below are denied access to the building and an education unless they wear a mask, while other children that are older enter freely. The only difference between these children are their eligibility to get a vaccine. Further, the proposed health order discusses separating children by vaccine status when 6th graders are physically separated from 7th graders. This also violates the statute. Just because our children are young does not mean they don't understand the unfair treatment. There is no logical reason why children 12 and under should be required to wear a mask in school, while outside elementary school in Johnson County, no other unvaccinated individual, adult, or even the children themselves are required to wear a mask. I urge you to vote against the health proposal today to avoid risking our school districts losing their state funding. I also urge you to vote against any further mask mandates in Johnson County. Thank you for your time.
Thank you.
We have Matt Couch. Matt Couch.
My name is Matt Couch. I'm a resident of Overland Park, Kansas. Johnson County Board of Health Order number 001-21 does two things. First of all, it creates a new extrajudicial arm of enforcement for the county and the health department. Literally every man, woman, and child, and I do mean children because we have thousands and thousands of teenagers that work and live in our county that are facing people every day in public. And when a member of the public comes in and says, I want to come to your store, and that teenager or senior citizen that works at Home Depot or Walmart says, sir, you need to put a mask on. These people are now de facto law enforcement members of our community. They're not paid. They're not trained. They have no conflict resolution experience. They have no ability to enforce this statute which you're laying on them. As far as I know, these people haven't been deputized by the sheriff. Is the Johnson County Sheriff's Department going to provide protection at every single public facility in this county in case someone gets into trouble trying to enforce this order? Second, this health order admits two things. First of them, that masks don't work. How do I know that? It says it right on the box. Not intended for antimicrobial or antiviral protection or related uses or uses for infection prevention or reduction of related uses. That's not me. This is the box telling you it doesn't work. The vaccine doesn't work. How do I know that? 74% of people in Massachusetts fully vaccinated, responsible for the outbreak. Iceland, Gibraltar, Singapore, Israel, 75 to 99% of the population vaccinated, having 2,500% increases. Finally, has anyone heard of the Lambda variant before today? Fauci announced it yesterday. COVID-19, Delta, now the Lambda. We're never getting out of this until we say no now. It has to stop today. And in honor of Nancy Pelosi, the Speaker of the House, that's...
Thank you.
Now we have Brian Glenn. Brian Glenn.
Good morning, Commissioners. Second step there. I'm hanging it up here. Never mind. So, I'm a licensed civil engineer in 5 states here in the Midwest. My views here are my own. You said my name earlier. And in Leawood, my address is on file downstairs in your tax office and will be probably for the rest of my life. I grew up and attended public schools here in the county. I'm now raising a family here. I'm today here for my kids, as well as the parents that don't feel like they can stand up and speak because they'll be ridiculed by other parents, by other people in the community. That's how bad it's gotten. with this issue. I bought this respirator that I tried to hang up in the early days of the pandemic, and I observed I was the only one wearing such level of protection as the cases continue to rise throughout the last year, despite near total mask compliance. Face masks are considered medical devices, and when they're used for an intended medical purpose, such as to prevent COVID-19 exposure, they're allowed under emergency use authorization as the FDA, similar to the vaccines. The EUA indicates that face masks are used for source control only. So protection of children and adults at home is paramount. Why not make these mandated for every parent, every child in the county? They're $100. That's well within the money that the feds and state is just throwing around and printing these days. So, the majority of the current data still shows that children are far less likely than the rest of the population to be impacted or transmit the virus. But as time goes on, children continue to be negatively impacted by our response to the virus. Studies are out on the impacts of children wearing masks. These include hypoxia, headaches, difficulty concentrating, and fatigue, to name a few. Not to mention the hard-to-measure social and mental effects. The true psychological toll of the lasting 18 months in our children won't be known for the years to come. Let's not make the problem worse than the cure.
Thank you.
Now we have April Ramdas.
Can you even see me? Okay, there you go. Okay, April Ramdas, Olathe, Kansas. I believe everybody has the freedom to choose whether or not to wear a mask. I drive a school bus for a high school, and high school routes are a little longer than elementary routes. It is miserably hot on those buses. It can get over 110 degrees on that bus. They don't have air conditioning. Think of a dog stuck in a hot car. Now put a mask on it. Are you willing to drive around in your car without air conditioning with a mask on? If you're not, then how can you ask these students to do the same? That's very much a rules for thee, not for me situation. Thank you for your time.
Thank you. Next speaker.
Excuse me, ma'am. Sorry, ma'am. We have Jenny Betar. Jenny Betar.
Close enough. My name is Jenny Betar. I live in Overland Park, Kansas. I am here because I respect the right of everyone in this room and every resident who isn't here today to make the choices that are best for them and for their children. Everyone here wants what they think is best for our children and our community, but parents in Johnson County are in the best position and have a right to make those decisions for their own children. The truth is, there is risk in life. It is impossible to eliminate it. COVID is just another risk. As parents, we cannot just think only about the risk of COVID. As parents, it is our job to assess and balance all the risks facing our own children and provide for them their best overall in health and well-being. Whatever parents choose, I respect their choice because it is their choice and their children. As elected commissioners, you do not have the right to force parents to accept a false choice between forced mask wearing and a reasonably normal in-person education experience in our public and private schools that we pay for. It is to provide everyone with the facts as you know them, openly and honestly. That includes being transparent when the truth is you simply just don't know. Your job ends there. Believe it or not, the greatest risk to our children right now is not the virus. The greatest risk is parents giving away our rights to decide what is best in the best interest for our own children. If you do not allow parents to make the best decisions for their children, you are overstepping, plain and simple. COVID doesn't change that fact and can no longer be used as an exception to the rule. What will be the next area in which you overstep your bounds in infiltrating the parenting of our children? What is your end game? Where does this end? We must hold the line right here, right now. We are not going away. This is our parents' right. not your right. By choosing to instate whatever you want to call this, you, commissioners, are saying that you know better than we do to raise how to raise our children. You're also saying that
I'm sorry, your time is up. Thank you very much.
Now we have Amy Dittaker. Amy Dittaker. Do we have Amy Dittaker?
Is Amy Dittaker available?
Okay, we'll move on at this time. Jenny Cox. Jenny Cox.
Jenny Cox, Overland Park. This is in regards to masking our kids in schools and also any future mandates regarding masks. How did we get here? All of this because of a failed peer review India study or a scientific study in Massachusetts in which 5 were hospitalized and there were 0 deaths? Or were the link between the Delta variant cases and deaths, they're greatly weakened? All of this based on a lack of evidence that masks even work. The burden of proof on masks working is on you. And most importantly, knowing your guidance will likely lead to schools requiring kids to lose their freedom to breathe in an American classroom. America, where laws rule the land, not mandates. We're reasonable people that can assess their own risk and choose. Where parents are in charge of their kids. If you mandate masks for our kids and in the future any other mask mandates, over half of your voters will be furious and feel like their rights have been taken away. If you vote to leave masks optional, we assess our own risk and we leave it in the and it's left in the hands of your constituents, where it should be, where it should always have been. We all win, and our kids will know what living and breathing in a free America feels like. Thank you.
Thank you.
Now we have Ben Hobart. Ben Hobart.
Ben Hobart, Westwood Hills, Kansas. My comments are directed toward this board's continuing gross negligence, recommending gene therapy shots to all eligible individuals with no warning or caveat addressing the adverse events of the jabs reported to VAERS. I've listened to a lot of physicians speak today. Why haven't they prescribed ivermectin? Is it perhaps because the CDC has suppressed it? There's recently been a dual-blind study at Sheba Medical Center in Israel where they showed the vast improvement that ivermectin gives to patients. It was shown in India, a vast reduction in deaths in a province. It was shown by Dr. Zalinda in New York City. Everybody's complaining about the ICUs and everything else, but they won't prescribe ivermectin, which works. Now with the dual-blind study, it's going to be even more difficult to refuse to do that. The Delta variant fear-mongering is pathetic. The UK Public Health Department issued Technical Bulletin 19 on July 23. The case fatality rate was only 0.2%, which is less than the 0.26% attributable to COVID-19. So what if it is more transmissible? Let it spread and let it fizzle out. I applaud all African Americans who have resisted the coercion of the jab. The CDC reports only 28.4% have taken the gene therapy jabs. Kudos. You remember the evil of Tuskegee, Alabama, and how our government spat on informed consent. They are doing it again, and you know it. The UK does not mask elementary-age children. They recognize the developmental and medical harm to kids. Dr. Areola, 13,000 hospitalizations out of 37.5 million child years is not a significant risk. You're going to find out today, unfortunately, Johnson County, abject lesson. Officials who don't listen to you, that's just the reality. Stand your ground. Don't back down.
Thank you.
Now we have Kristen Butler. Kristen Butler.
Hello. Thank you guys for spending your day with us. My name's Kristen Butler, and I reside in Shawnee. My address is on file. So I have a question. Would you rather be publicly shunned and treated like you're diseased by your friends and coworkers, or would you rather struggle for breath and feel sick for 7 hours of the day? I know it's hard, but that was the choice that my 7-year-old had to face last year. Her teachers and her school nurse should have seen the reason for her constant trips to the nurse's office with headaches, nausea, vomiting, and inability to breathe, considering there was something on her face preventing her from breathing. But they let her sit in an office with a mask on until her mom came to pick her up 2 to 3 times a week. This had to stop. Her mask was suffocating her, and no one was helping. There was nobody that even suggested taking her mask off. So after the school couldn't do anything, I went to the school board and requested a hearing, and they denied even hearing me. So I went to a doctor and had her assessed, and it turns out that her blood oxygen saturation drops to 88 in 2 minutes of wearing a mask. And if our parents were checking, they would see some of the same things in these other children. We have to check. We have to see if there is something going on. Hypoxic brain injury is real. You are not an expert on my child or the children in this district, in this county, but you are responsible. Their health isn't your business, but you are the ones that have the burden of providing proof to us that masks work and that they help prevent the spread of COVID. Give me a peer-reviewed study. I request that of you publicly today. Thank you.
Now we have Daniela Herman. Daniela Herman.
My background is clinical psychology. COVID isn't deadly for kids. The positive rate in Johnson County is less than the CDC's high transmission threshold, which is skewed because we're only testing the symptomatic. Forcing masks on kids is child abuse. Suicide among kids, teenagers, and young adults is higher than ever. Kids falling behind academically, mental health issues at an all-time high. What happened to those promised mask breaks? They were a lie. No mask breaks were given, and kids were shown no mercy. Instead, the teachers came up with unfair, cruel punishments for kids who dared let the mask slip for a moment. These are true stories from kids in this county. Special needs kids have been abandoned and neglected because the masks make life unlivable for them. Girl age 9 developed severe anxiety. A bully in her class wiped someone else's spittle with his poor girl's mask. When she pulled it down in disgust and decided not to tattle, the teacher made her walk laps during recess for non-compliance. Boy age 9, severe asthma, restricted airway, has debilitating asthma attacks when wearing a mask for more than 10 minutes. Girl age 7, learning delays, sensory issues. Falling behind academically will worsen with another year of masks. Her teacher publicly humiliated her on several occasions for having a dirty mask when in fact it was a Sharpie stain that the mom couldn't remove. Boy age 11 with speech issues didn't make a single friend as he struggles to talk through the mask. His only friend is the principal. His physiological stats with the mask are horrible. Boy age 15, due to social distancing, goes entire days without saying a word to anyone. Now suffers from extreme depression, has permanent headaches and nausea when wearing the mask. Special needs boy, nonverbal, can't do virtual and can't mask. Went 6 months without schooling or any therapies. Doesn't understand what people are saying when they wear masks. All this is inhumane and a violation of children's basic human rights. You have abandoned the kids of this country to physical and mental torture. Do you care? COVID is not going away. How many more years will you destroy their childhoods? We will not comply. We care about the children of this country very much and the long-term damage.
Your time
this
is up.
doing.
Thank you very much.
Thank you.
Trying to fix a technical problem.
Now we have Patty Puricelli. Patty Puricelli.
Hi, I'm from Overland Park, Kansas. My kids graduated from Blue Valley High Schools. I have a bachelor's degree in logic. I have a master's degree in motherhood. But mostly I'm board certified in being a freedom-loving American. And I am not paid for my opinion. I don't know about the other speakers. The U.S. Constitution was designed to limit control of the government. That means it was designed to limit your control over us citizens. We fought a civil war, and we are no longer subjects. In my 53 years, I can think of no greater abuse of control on American citizens' freedom than what you and other board members have imposed on the citizens of Johnson County. I know, I hear it's all about following the CDC guidelines. The CDC is a private institution who receives its largest amount of funding from medical companies. The CDC then imposes mandates to require Americans to buy things to put on our face, to buy products to inject in our body, and medicine to take. But the CDC only makes these recommendations, thankfully. Let's look at what else, the CDC recommends that I don't listen to. Just yesterday, I ate my eggs over easy. I ate oysters at lunch. I had a Caesar salad and a steak, and I ordered it rare. All those violate CDC guidelines too. This might be a slippery slope, right? Because, what's next? Well, the other day, the Center for Disease Control said that I might face 1 year in jail if I evict a tenant that is not paying my rent of rental income. It stops with you. I urge you to choose freedom. If government can restrict the freedoms in the face of an emergency, there will always be an emergency. Choose freedom for my face and let me eat rare steak.
Thank you.
We now have Wendy Connolly. Wendy Connolly.
Thank you. I'm Wendy Connolly from Overland Park, and first I want to especially thank the police officers for their protection this morning. The last time I attended a BOCC meeting was July 11th, 2019, with my 2 kids who are Scouts. You welcomed them warmly, you introduced them during the meeting, and we even got a photo afterwards with Commissioner Hanslick. They were working on requirement 3A of their Citizenship in the Community Merit Badge, which required them to attend a Board of County Commissioners meeting. If you're familiar with Scouts, you know of their commitment to patriotism, service, and civic duty. And throughout this past year, I've watched my kids embody these virtues by making sacrifices of their own freedoms to protect others, to do their good turn daily to stop the spread of COVID. They missed out on birthday parties, indoor gatherings, and church. My kids gave up a year of in-person learning and circled up in driveways to eat lunch. They rallied 8 friends to get their COVID vaccines together at Oaken Fieldhouse and made signs to encourage others on social media, Scouts saving grandmas. My kids understand what it means to practice citizenship in our community during a global pandemic. They make sacrifices for the sake of others, even when it's uncomfortable and inconvenient. And they do so cheerfully and without complaint. They follow the guidance of our local Johnson County Department of Health because they respect their authority. Today, I'm asking you to be role models of good citizenship and patriotism that my kids can look up to. Mandate masks in schools at all levels. Give my middle and high school kids a school year without constant sickness and interruption. Please do your good turn today and cast a vote worthy of that citizenship in the community merit badge. Thank you.
Thank you.
Now we have Joanne Atchity. Joanne Atchity.
Good afternoon, Commissioners, and thank you for your attention. I am a living woman called Joanne Atchity, and I live in Shawnee. For 18 months, we've watched as propaganda and fear-mongering have been weaponized to intimidate and control us. We have shared with you that the so-called virus has to this very day never been isolated. We've told you how the PCR test does not and cannot diagnose disease. And Commissioner Eilert, it was not lost on any of us that you cut off Commissioner O'Hara from asking Dr. Areola to address that very question. It is important. We have listened as healthy people were called asymptomatic carriers. We are healthy people. We watched doctors and scientists who said as much be censored, smeared, and even arrested. We watched as effective, even curative treatments were suppressed, while dangerous experimental treatments such as remdesivir were pushed. Now we are being coerced and bullied into getting an experimental injection of a gene editing therapy that is killing and injuring thousands. We have known from the outset that we were being played, and many of us didn't buy it for a minute. As more comes to light and the house of cards falls, it is easier to see the fraud and the deception. People who could see the lies, but who were going along to get along, have now had enough. Many more are newly awake to the government overreach and tyranny, and we are standing up. We are aware of and standing for our innate God-given rights and freedoms and coming together as a community. I am a member of Kansans for Health Freedom, kshf.org. The mission of KSHF is to restore the concept of informed consent. Our membership is growing like a Kansas wildfire. We know that community equals immunity, and together we are...
I'm sorry, your time is up. Thank you very much. I'm sorry, I'm sorry your time is up. Thank you very much.
Now we have CJ Hare. CJ Hare. Are you CJ?
Yes, ma'am.
Thank you.
Good morning, or afternoon, I guess now, huh? My name is CJ Hare. I am a firefighter from Shawnee. I don't want to give my address out because I've already had problems with people vandalizing my house, so I'd prefer not to do that. I am a firefighter. My wife is a nurse, and we are concerned about the misinformation about this mask mandates, both with children and in general. I just want to ask how many people who are wearing masks today have been fit tested for those masks? Because if you're not fit tested for a mask, it does not work, including N95 masks. The surgical mask that we are wearing, I've timed it. We should have had about 12 mask changes in the time that we've been here this morning, because 20 minutes for a surgical mask is the absolute most time that that mask becomes saturated. Also, what is our end goal of this? Is it 0% COVID? Because it's not going to happen. We are going to be taking a flu shot and a COVID shot at the same time for the rest of our lives. and to address the children. Basically, hypercapnia in children. Studies have shown that hypercapnia, which is CO, being absorbed into lungs by children, is 7 times more than a normal adult, 25,000 parts per million, which doesn't mean a whole lot, but when you look at a normal adult that you breathe normally, it's 2,000. And the kids who are breathing this hypercapnia, it is causing lung problems, it is causing developmental delays in children. Also, we have to also talk about what Children's Mercy said when everybody said that their hospitals are overrun with COVID patients. They came out and said it's RSV. What is oxygen deprivation in a kid cause? RSV. Thank you.
Thank you.
Now we have Kristen Leteau. Kristen Leteau.
Hello, my name is Kristen Leto. I live in Leawood, Kansas. Thank you for allowing me to speak today and for the job that you do. I know it is a thankless one. I know there's nothing that I can say today that will change your minds, so I am appealing to God, the maker of heaven and earth. Father God, please remove the blinders from the eyes of these commissioners. Help them to see and hear the truth today amidst all the noise. Thank you that you, Lord, are still in control and the only one that we need to follow and obey. Today, young children are about to be mandated to be abused. Please, Lord, don't allow that to happen. You warn us to not be fearful and to not let anyone deceive us. Please, I beg you, remove the blinders so these commissioners and others can see the deception that is all around them. Please intervene today. Amen. So why are we mandating masks? Is it really about the health of the children? Why would you want them to sniff the bacteria that is in the mask all day long? And please don't tell me that doctors wear them all day. They change their masks between patients. They also know to wash their hands. How many kids wash their hands constantly? They constantly touch the mask just like you and I do too, because they're uncomfortable and they're hot and they're annoying and we can't understand people when they talk. My child got a rash around his mouth from wearing the mask. That is what the doctor said. I have friends whose kids have gotten repeated sinus infections, and it was diagnosed because they were wearing a mask all day. So the hospital has a lot of RSV patients right now, most likely from wearing the mask. Viruses are on those masks. There are studies showing that. If it's really about the health, then shouldn't we be concerned about the 5-fold increase in suicide from teenagers because we're making them wear masks? Masks cause anxiety and depression, but no one's talking about it. If it's really about health, then show me the proof that a child has caused any death of any teacher. If it's really about health, tell me where the number is of kids who have died from COVID.
Okay, I'm sorry, your time is up. Thank you very much. Your time is up. Thank you.
Now we have Maria Lawrence. Maria Lawrence.
Hi, good morning or afternoon. My name is Maria Lawrence, and my children go to Johnson County schools. Johnson County Health Department. Johnson County Health Department is what my daughter heard all semester. Devastated every time she had her mask slightly below her nose, she heard fear. She heard, "You're going to kill someone if you don't comply." She was told that the Johnson County Health Department would come get the kids who weren't wearing their mask properly. Meanwhile, she saw that the teachers take breaks and walk around with their masks down. It simply wasn't about safety. It has never been. It's simply about shutting up and complying. I'll get straight to the point. This fear-based propaganda will not work in Johnson County anymore. Kids present nearly zero risk of severe COVID outcomes. So why are you mandating that we mask them? Children should not wear face masks. They don't need it for their own protection, and they don't need it for protecting other people. My child is not responsible for somebody else's health. I am the parent, not you. I am not being selfish. I'm simply the most educated when it comes to my children's body. As I saw kids coming out of school almost fidgeted with their mask, readjusted it more times than I can count, all while their fingers have touched various surfaces. Societally, they're made to feel criminals, putting somebody else's lives in their hands. Mental, physical, psychological health goes out the window. Our bodies are powerful. My children's bodies are powerful. Over time, the vaccine will lose its effectiveness. What will we do then? What is the other fix that's coming next? Will we keep wearing masks for the rest of our lives? No. That still does not give you the right to dictate what my child does with their body, what they decide, or what we decide is best for our family. I'm one of the few people of color here, and I'm proud to say that. I speak for myself and all of the voices that are too scared, too intimidated, too worried about losing their jobs, too worried about speaking up because family or friends will think that they're crazy. For those who think that they're too worried about how they're going to juggle online school, we do have an option. Si tenemos una opción. We do have a voice, and no one can take it away from us. Your time has expired. And it's amazing in a climate where we can choose whatever we want. We have to fight to choose this. So let Johnson County have a choice where we decide what the individual decides is best for their own body. Thank you for your time.
Thank you.
Now we have Chelsea Harper. Chelsea Harper. Do we have Chelsea Harper?
Is Chelsea Harper available? All
Okay,
right,
I'll
let's
move
go on to the next.
We'll have Cassie Woolworth. Cassie Woolworth.
This morning, I did not have a printer available, so I only printed my stuff from a friend. The first thing I would like to do, my name is Cassie Woolworth. I live on Pinion. Y'all know me. I want to thank the doctors. Dr. Ellis, Dr. Schaff, Dr. Wong, Dr. Allen, Dr. Jenner, Dr. Hettinger, Dr. Finkel, Dr. Gupta, Dr. Julian, Dr. King, Dr. Areola, and Dr. Lemasters. It's funny they go after Areola, but they never talk about Lemasters. If you are a Kansan for freedom, does that mean abortion too? Woohoo! My body, my choice, huh? Kids are not deadly. Is that the way this works? 350 children have already died from COVID. Do you guys not read the news? Hospitals are refusing transfers. Science is not truth. Science is finding the truth. When science changes its opinion, it didn't lie to you, it learned more. We know masks work. We went back to school last year. The whole point of me being here is I want kids in school. I think everybody wants kids in school. We don't have daycare, but thank you, Laura Kelly, because now we do have some $500,000 available for daycare. If you are a single parent, please look online. Laura Kelly has solved some of your daycare problems. She hasn't solved mine. If the kids come home after a week, I'm stuck at home again. Isn't that what we're hearing? You guys really want to send them all to school without masks so that they can come freaking back home? 1 week. It took less than a week for most of the schools to already close that are open. And let me explain to you, I got a note from Olathe West football yesterday, and Olathe West football has been sent home because they're not quarantined, which is way too much fun because they will all miss the first day of school. And because the Kansas legislature is so incredibly smart, and the school boards did this, we don't have a virtual option. When the kids come home, you ain't training them. They ain't going to school. There's no virtual option. You get to babysit and figure out if you really want to take them to the pool every day. Oh, wait, the pool's closed because it's after Labor Day. What are you going to do with your children? Do not mistake inconvenience for oppression.
I'm sorry, your time is up. Thank you.
Now we have Pat Land. Pat Land.
Hey, I once again will ask those in the atrium to respect the difference of opinion and please keep the volume down. That does not help anybody at all. Thank you. Go right ahead, sir.
Hi.
Or ma'am, I'm sorry.
That's all right. I have 4 grown daughters and 13 grandchildren. I have 6 that are school age that were pulled out of school last year One of those is special needs, and she has been denied service because she can't function with a mask. I think we can all agree that science is far from settled on this issue. There are way too many variables and way too many changes of minds. I think it's safe to say this virus is here to stay and is not controllable, except by good immune system. I urge you to not put masks on our children, to let them go back freely. I noticed, I was at DMV yesterday, there's masks on the doors, and I came in and said, are we required? And they said, no, you can choose. And I thought, yes. And I came here today, and I see that I can choose to wear a mask or not. I think that is just a lovely compromise. And if parents can choose whether or not they want to send their kids in masks, I think that's imperative, and I think it's imperative that the parents are allowed to choose. The higher issue is choice. The higher issue is rights. And I urge you not to abridge those rights. Thank you.
Thank you.
We now have Dr. Robin R. DeSato.
Hi, my name is Dr. Robin Desatel. I owned and operated a large clinic for 24 years. We saw over 270,000 patient visits. I've written one book called The Truth About Neuropathy, and I'm currently writing a second book about the truth about germs. So I'd like to just share some experience from the 29 years of me being a doctor and give you some interesting findings. So we all have 380 trillion viruses in our bodies. One drop of seawater has 10 million viruses. We're told that viruses are attacking us, yet we have 380 trillion viruses in our body. So is it possible we've been lied to? The father of the germ theory, Louis Pasteur, falsified his findings about germs and vaccines. In 1965, his grandson released his notes, which had never been before seen by anyone. They were published in a 1995 book called The Private Science of Louis Pasteur. And the book confirms that Pasteur had no valid studies for germ theory or vaccine effectiveness. He was paid by the French government to propagate false data. Louis Pasteur is quoted on his deathbed as saying, "The germ is nothing, the train is everything." He's actually saying germs don't cause disease. Friends, COVID is based on germ theory, which is false. The very inventor of the PCR test, Carey Mullis, is quoted many times as saying, you can't use the PCR test to diagnose a virus or an infectious disease. He suspiciously died in 2019. So is it possible we've been lied to? Dr. Fauci stands to gain 50% of the profits from one of the vaccines, and the CDS owns more than 50 patents related or connected to vaccines. This situation creates an obvious conflict of interest and should make you rethink who you're trusting. From my clinical experience, masks cause headaches, respiratory issues, and worst of all, a subconscious fear of one another when we're created to love one another. So we should be allowed to decide for ourselves what we do with our bodies regarding masks and vaccines without any interference from the county, state, or federal government. This is our constitutional right.
I'm sorry, doctor, your time is up. Thank you very much. Your time is up. Thank you.
Our next speaker is Julie Kramer. Julie Kramer. Are you Julie Kramer?
Is Julie Kramer available?
We will move on to Lan Clark. Lan Clark. Are you Lan?
Yes, I am. Thank you. Good afternoon. My name is Lynn Clark, and my address is on file.
We are in an information war, truth versus lies. Let me point out 5 very important things that have led us to where we are today. Number 1, the models that said 2.2 million people would die from COVID are false. Number 2, the PCR tests are falsely calibrated to receive a positive test result. Carrie Mullis, who invented the tests, said they are being incorrectly used, and the CDC has just admitted the tests are not accurate. Number 3, COVID-19 is 100% curable with therapeutics, ivermectin, and hydroxychloroquine. Number 4, the COVID survival rates range from 99.97% for ages 0 to 19 and 99.47% for anyone over the age of 70. And the flu disappeared last year. We are here today as citizens of Johnson County to express our views on whether we think there should be a mask mandate. It is not the responsibility of the federal, state, or local government to tell us what to do to our body. The board was elected to protect our rights under the Constitution. When this virus started 18 months ago, we heard, don't wear a mask, wear 2 masks. PCR tests work, now they don't work. Get vaccinated and you can take off your mask. And now, even if you're vaccinated, you have to wear a mask. It's time we, the people, call the lies out and demand the truth. Now is the time for every citizen of Johnson County to take personal responsibility for their health and their family's health. Show us the science behind the mask wearing. The CDC can't even show reliable scientific studies that show they work. There was only one study the CDC reported regarding mask wearing. It came from India, and the study was rejected during a peer review. The Biden administration is unable to provide any proof that the Delta variant is real, and the White House press secretary admitted in a press briefing on July 30th that she has no idea if there's even a test for this variant. I would remind all the citizens of Johnson County that a mandate is not a law. You can't be arrested or thrown in jail for not following a mandate, and the county commissioners don't have authority.
I'm sorry, I'm going to have to ask you to conclude your comments. Your time is up. Thank you very much.
Now we have Jason Hartwell. Jason Hartwell.
Can you update the list so we can see it, please?
Hi, good to see you again. Jason Hartwell, live on 164th Street in Olathe. So we've heard all these doctors talking, all these people coming up here talking about all these new cases and the Delta variant, all these new cases. I want to know why they're not talking about hospitalizations and deaths. In the United States, since COVID began, there have been 349 deaths of children under the age of 18. 349. There have been 50,000 deaths from other causes in that time. Hospitalizations, 3,300. Children under the age of 18 have been hospitalized with COVID in the entire United States over the last year. 775,000 people a year, children a year, die from sports-related injuries. Yes, people need to put these numbers in perspective. Are we stopping sports in school, or are you letting your kids play football? We wouldn't think of stopping sports. Give parents their choice. They can choose to have their kids play football, which is just as dangerous, and they can choose to have their kids not wear masks. None of the science has shown that masks are effective. You watch our own politicians, Dr. Fauci himself, taking his mask off around crowds in a baseball game. Some of you in here have been caught in public without a mask while you had a mask mandate. It's not do as I say and do not as I do. You represent the people. You represent us. Look around you at how many people are out here today. What are they telling you? Walk into a grocery store. How many people do you see wearing masks right now? Less than 5%? Quit catering to those 5%. Cater to the rest of your constituents that voted for you, that you're supposed to represent. Represent your people, do your damn job, and follow the Constitution. Give us our liberty. Thank you.
Thank you.
Now we have Thad Snyder. Thad Snyder.
Thanks for the plexiglass, science. Thad Snyder, Olathe. To the people at home, there are thousands of people out there when this started, so don't feel like you're alone. You are not. You are the majority, and we are going to get loud, starting with this speech. For well over a year now, we've had our God-given rights trampled upon by feckless and dangerous elected officials and unqualified and unelected bureaucrats like Dr. Areola. No more. These mandates they vote on are not laws. They are not enforceable as such, and therefore we do not have to abide by them. When this sham of a board today tries to take away your child's right to breathe, do not comply. We are a free people endowed with unalienable rights bestowed by God, not by politicians. They have no right to infringe on our rights to breathe freely, move freely, operate our businesses freely, and send our children to school free of unconstitutional mask mandates. If this board or the school board attempts to mask your child, then pull your child out of public school immediately, unenroll them, and they will drop the mandates. If you keep them out through September, the school will not get any funding from the state. Instead, find a co-op of like-minded patriots to school them and give your kids a real education based on our founding principles of life, liberty, and the pursuit of happiness, versus Marxist indoctrination. When they were elected, this board took an oath to uphold the Constitution and protect the rights of free citizens. If the board votes to impose this unconstitutional mask mandate, then we, the people of Johnson County, need to hold a recall election immediately and replace them with people who will take their constitutional oaths seriously. We went along to get along once. We will not do it again. We consent to be governed, and in doing so, it is the job of elected officials to protect our rights, not to illegally trample on them. I'm calling on the sheriff in Johnson County to immediately arrest any one of the county or school board members who votes to mask our children again. We will not acquiesce to tyranny. Enough is enough. If any business or restaurant tries to force you to wear a mask, don't shop or eat there anymore, and tell all of your friends to do the same. There are far more people who value freedom than those who subscribe to the ever-changing, often wrong edicts handed down by the CDC and the federal government. Do not comply.
Thank you. I'm sorry, do we have the next speaker?
Yes, one second. Thank you. We now have Andy Cross. Andy Cross.
Andy Cross from Shawnee. All right. As far as you guys are acting like Prince John, where's your sheriff of Nottingham? I want to look at him in the eyes. I notice that you have other city employees sitting over there, so as far as the one that's you're using to burden us with that, he should be in this council chamber hearing this also. I mean, otherwise you guys are just running flack for him for this issue. By what law are you making this decision supporting Shawnee Mission School District's behavior? Because your judge knocked down this portions of that law. So now you guys are assuming the rights of deciding that law. I don't think you guys have that legislative authority right now. The Delta variant in India lasted April and May. In England, it has also passed in May and June. This is a 2-month cycle. So that's what I expect as far as what's going on. From the National Institute site, they have the Nuremberg Code listed as a document. The voluntary consent of the human subject is absolutely essential. This means that the person involved should have legal capacity to